Sir, we are live.
Recording in progress.
Sir, we are live now.
Helen, please start.
Can I start?
Please go ahead, ma'am.
Okay. Thank you so much. First of all, good evening, everyone, and I welcome you all to this program. I would like to take this opportunity to thank our Dr. Sunil Gupta for his enthusiasm in reaching out, and I'm very sure that this small session that we are going to have today is going to carry on and have a very, very, very big impact for the women in Manipur. So, without much ado, I'd like to invite Sir to give us a brief insight into what this session is all about. Dr. Sunil Gupta, sir.
Thank you very much, Dr. Helen, and I welcome you all for this PregaTalk. We have our chief guest for today's function, Dr. Y. Prem Chandra Singh, and we also have Dr. Helen as our moderator, and we have 4 eminent panelists here. We have Dr. Ratna, we have Dr. Santa, and we have Dr. Sadra and Dr. Kash. And this PregaTalk is basically a brainchild of Dipsy almost 4 years from now, when in 2021, when I was the president of Diabetes and Pregnancy Study Group India, उस समय हम लोगों ने सोचा था कि कुछ ऐसा पब्लिक अवेयरनेस प्रोग्राम किया जाए, but then public awareness program can be sometimes only in Hindi, can be sometimes only in English. कभी-कभी because this particular organization has got originated from Tamil, so we can do in Tamil. फिर ऐसा होता था कभी कोई अपने रीजन में कर रहा है, कभी नहीं कर रहा है. So we decided in my presidentship कि why not to have the public awareness program on pregnancy diabetes or gestational diabetes across the country, so that हम लोग हर एरिया के, हर रीजन का, जहाँ रिमोटेस्ट जगह में भी एक किचन तक पहुंच सके और वहाँ की महिलाओं को, वहाँ की वुमेन को हम एम्पावर कर सके, जिससे जैसे आज की तारीख में कोई भी प्रेग्नेंट होता है तो इट इज ट्रेडिशनली वुमेन नो कि मेरा हीमोग्लोबिन टेस्ट करेंगे, मेरा ब्लड ग्रुप टेस्ट करेंगे, मेरा HIV टेस्ट करेंगे, बट दे आर नॉट अवेयर कि एक प्रेगनेंसी डायबिटीज नाम का भी कंडीशन होता है और भारत देश की हर 5वीं गर्भवती महिला को यह हो सकता है. दे आर नॉट अवेयर ऑफ इट, एंड फिर वो मिस हो जाता है. मिस होने के बाद अल्टीमेटली वन फाइन डे यू कम टू नो कि बेबी को ऐसा हो गया, कभी बेबी का साइज बढ़ गया, कभी बेबी का वजन नहीं बढ़ रहा है, कभी बच्चे का पेट में डेथ हो गया. ऐसा बहुत सारा चीज कॉम्प्लिकेशन होता है और इसीलिए अवेयरनेस अमंग्स डॉक्टर्स, awareness amongst diabetologists, physicians, clinicians, awareness amongst obstetricians, gynecologists, as well as awareness amongst diabetes educators, और साथ साथ में हर फैमिली मेंबर को, जहां एक चाइल्ड बेयरिंग पोटेंशियल वुमेन घर में रहती है, वहां इसके बारे में मालूम होना बहुत जरूरी है. आज की तारीख में भारत देश में अराउंड 10 करोड़ डायबिटिक्स हैं और करीब 13.6 करोड़ प्री डायबिटिक्स है. दैट मीन्स टोटल यदि हम देखा जाए अडल्ट पॉपुलेशन 94 करोड़ से भी हमारे देश में है, तो उसमें से ऑलमोस्ट 24 करोड़ पीपल अबव 18 इयर्स ऑफ एज have either diabetes or pre-diabetes. और इसमें से कई यंग वुमेन है जो कि आगे जाके प्रेगनेंसी के रास्ते से गुजरने वाली. इसीलिए हर महिला को एडल्ट 18 साल की उम्र के बाद मालूम होना जरूरी है कि यह भी एक डायबिटीज होता है प्रेगनेंसी का, जिसको हमने अर्ली डायग्नोसिस करना चाहिए, जिससे हम सिर्फ बच्चा ही नहीं देना, हमको अच्छा बच्चा भी तो हम जन्म दे सके. और बच्चा अच्छा भी ऐसा नहीं कि सिर्फ अभी अच्छा है, उसका भविष्य भी अच्छा देना पड़ेगा हमको कि वो वो जब एडल्ट होता है, जब वो 25 साल का होता है, तो उसको डायबिटीज ना हो, उसकी भी तैयारी हमको प्रेगनेंसी के समय से ही करनी पड़ती है. और इस बारे में जब हम अवेयरनेस करना चाहते थे तो यह सभी लोगों की मीटिंग में ऐसा आया कि why not to start this program in multiple languages. So Indian Constitution have 23 languages in their constitution. और हमने हर लैंग्वेज में इस पर अवेयरनेस प्रोग्राम वहाँ के रीजनल फैकल्टी को लेकर चालू किया। आज की तारीख में आप लोग बहुत नसीबवान हैं और हम लोग भी बड़े हैप्पी हैं कि पिछले साइकिल में अनफॉर्चुनेटली हम मणिपुरी लैंग्वेज में नहीं कर पाए थे, पर इस समय ब्याज के साथ में हमने हेलन मैडम को बोला कि पिछला वाला भी आपको कवर करना है जो हमने नहीं कर पाया, और पूरे एंथुजियाज्म से आपको ये प्रोग्राम करना है। तो टुडे इज द 50th program, and you should be lucky to have this. Yeah, so Manipuri will go as the 50th program of PregaTalk of the second cycle, total program, and we are very happy to be with you all. And we'll continue this with the help of our faculty as well as getting more new faculty in the next cycle. So thank you very much, Dr. Helen, for getting it coordinated. I should be failing in my duty if I don't thank Dr. Priti Kumar from Lucknow, who has actually coordinated and got connected me to Dr. Helen. And she was very positive and proactive. As well as I'm thankful to our chief guest that he has accepted to join this, a very senior diabetologist from the state of Manipur. So we are thankful to him for joining as well as all the faculties. Now I won't take much of the time because ये program पूरा मणिपुरी में होना है, तो हेलेन मैडम और आप लोग मिलकर अच्छे से बात करें, मैं सुनते रहूंगा, मुझे जितना समझेगा समझेगा, नहीं समझेगा मैं बाद में पूछ लूंगा। परंतु इट इज हैप्पी, आई एम वेरी हैप्पी कि वहाँ रीजन में, उस रीजन में भी आज हम अवेयरनेस का काम कर रहे हैं। और इसके पहले कि मैं भूल जाऊँ, यह कार्यक्रम लाइव है और मणिपुरी लैंग्वेज में ये हमेशा यूट्यूब पे रहेगा। तो आप जब भी हेलो डायबिटीज और प्रेगा टॉक मणिपुरी टाइप करेंगे तो आपको आ जाएगा। हर फैकल्टी से मेरा रिक्वेस्ट रहेगा कि वो अपने क्लिनिक में इसको रन करें, जिससे कि everyone can be benefited, those who cannot really attend today at this moment of time. With this, I welcome you all on this program. And importantly, Diabetes and Pregnancy Study Group India is being founded by Padma Shri Dr. V. Sheshaiya from Chennai. And he is a person जिनके मार्गदर्शन में हम ये काम करते हैं। So my gratitude to Dr. V. Sheshaiya also on this meeting. And 10th of March, very next week, 15 days from now, is the National GDM Day. 10th of March is National GDM Day. और मैं चाहूंगा यह कार्यक्रम हो भी जाए तो भी नेशनल जीडीएम के दिन आप फिर से इसका प्रसार कर सकते हो, लोगों को बता सकते हो, तो एक नेशनल जीडीएम डे का भी सेलिब्रेशन आप कर सकते हो, क्योंकि इंडिया इज द ओनली कंट्री इन द वर्ल्ड जहाँ पर कि नेशनल जीडीएम डे सेलिब्रेट होता है। तो अवेयरनेस के लिए दैट इज अनदर थिंग वेयर the Manipuri faculty and Manipur faculty can certainly be proactive even on 10th of March. With this, I stop here. Thank you very much once again. Over to Dr. Helen for moderation, as well as inviting our chief guest to speak few words. Over to you.
Thank you so much, sir, for your kind words, and like really the insight that you have given is a big encouragement for all of us, and we look forward to celebrating the National GTM Day, of course. Without wasting much time, I'd like to introduce our chief guest for today, Dr. Y. Prem Chandra. I'd like to tell this about sir that he's presently a joint director health services, and he is a known diabetologist and has been working very, very actively as a nodal officer for the state NCD cell NHM Manipur. Sir, we would appreciate brief words of encouragement from you and your perspective on the Manipur scenario regarding GDM. Sir Prem Chandra.
Thank you, Dr. Helen, and thank you to the organizers of the PregaTalk. It's indeed a great privilege to be amongst you all and this important talk on the diabetes in pregnancy. And it's again very welcoming to note that today's recording is being done during the nationwide campaign which was started yesterday, the intensified diabetes and hypertension screening campaign all over the country. So the government has come up with a objective of screening all the people above 30 years for diabetes and hypertension, and including the pregnant mother. So this was started since April of this year, but the last 40 days, government is coming up with an intensified campaign to reach all the gaps. And Manipur is also one of the state. And the program was launched yesterday with a daily target of around 17,000 screening per day. So since yesterday, all the health centers, all the PHCs, sub-centers, district hospital, PHCs, and all the forming team and started the screening activity. So these things are going on. And side by side, the diabetes in pregnancy is under the government of India's guideline is being looked after by the two divisions of the National Health Mission, that is the maternal health and the NCD division. So in today's talk, I think sure that all the panelists, the experts, our respected Sir Dr. Achoba, Head of Department Endocrinologist here, then the gynecologist, the Associate Professor Ratna Sarda, and dietitians are there. So this will be a good uh, deliberations, and the learnings here will be very beneficial to the public. And most of the talks, I believe, will be in Manipuri. So people will be getting more in touch with the subject. And of course, we need to walk many things ahead. Like in the opening comment, we have seen that we are yet to widely start the GDM screening. Of course, the GDM screening has been started in our state, but the wide coverage is still not seen. And the DIPSI guideline and the government guidelines, we have to see, because some areas are there where there's a controversy of insulin versus metformin, and that the panelists will be explaining that. However, we need a lot of work in the pre-pregnancy planning, with the pre-conceptual counseling, the education to the pregnant mother with those diabetic mother to control their diet or to keep their sugar level, or like the pre-pregnancy the pre-pregnancy diet control and sugar control is very much required. Or and of course, like they say, whether we should go for contraception before controlling the sugar, and the what is the ideal way of testing the sugar, the one-step method or the two-step method. Of course, the one-step method has been advised in all the health centers in our state also. The 25 gram has been done. So the panelists and expert, I believe that we will discuss all in detail, and I wish the deliberation a success. Thank you all.
Thank you so much, sir. With the amount of activation and push you have been giving to NCT, it was like really overwhelming to us also initially, but now we feel good and I'm sure things will work out. So with permission from Sir Dr. Sunil Gupta and our chief guest, I think I would like to start the session by introducing our panelists. Our senior most panelist here is Dr. Achoba. Sir is a HOD Department of Endocrinology, Jenin. Sir has been Sir has had a long stint of being the only endocrinologist, but now he has encouraged so many people to take up endocrinology, and many people will be joining his party, and hopefully will be bringing about treatment and creating awareness of gestational diabetes, like to the common people, and will benefit the common people very soon. Sir, welcome.
Thank you.
Next, I'd like to welcome Dr. Ratna. Madam Ratna Usham is Associate Professor, Department of Obs and Gynae, and she is a very active worker and a strong proponent of mother and child health care. Madam has been working very actively on lecture program also. So welcome, Dr. Ratna. Next, next I'd like to welcome Dr. Okram Sharda. Sharda is a young, upcoming what do you call, battery of power, which does not need sun or anything, but seeing the amount of work she has been doing in such a short span, Sharda, we expect a lot more, and I'm sure you'll be the one carrying the torch for this activity against gestational diabetes forward. Welcome, Dr. Sharda.
Thank you so much for the opportunity and for the sweet words, Dr. Helen.
Yeah. And lastly, I'll welcome Miss Santa. Santa, I have mentioned you last because people they don't give much credit to what you eat. They are all about taste and stuff. But the thing is, taste and good food can go side by side. And I'm sure you will give us a lot of insight into what we eat. We should look out what we should look out for what when we eat, how to decide and how to help the women in general to decide how they can eat have that tasty food without compromising the nutritional quality. Welcome, Miss Santa.
Thank you. And I hope I will deliver the best from my end.
Okay, thank you so much. Okay, so as soon as you start in a local language, I hope you'll get few words in between. So, ahobada ay sir at yobadagi oy na hozage akoy senior most faculty panelist at lady basita. Sir, diabetes maramda khara ꯉꯥꯡꯕꯤꯔꯗꯤ ꯌꯥꯝ ꯅꯨꯡꯉꯥꯏꯖꯒꯅꯤ ꯀꯩꯒꯤꯅꯣꯗ ꯉꯁꯤꯒꯤ ꯁꯦꯁꯟꯁꯦ ꯃꯦꯟꯂꯤ ꯃꯤꯔꯣꯟꯕꯤꯗꯕꯨꯗꯤ ꯗꯥꯏꯔꯦꯛ ꯇꯧꯋꯦ ꯍꯥꯏꯔꯁꯨ ꯗꯥꯏꯕꯤꯇꯤꯁꯁꯦ ꯀꯃꯥꯏꯅ ꯏꯟꯁꯤꯗꯦꯟꯁꯁꯦ ꯑꯩꯈꯣꯏ ꯁ꯭ꯇꯦꯠꯇ ꯀꯃꯥꯏꯅ ꯂꯩꯒꯦ ꯊꯥꯏꯅꯗꯒꯤ ꯍꯧꯖꯤꯛ ꯐꯥꯎꯕꯗ ꯗꯥꯏꯕꯤꯇꯤꯁ ꯔꯦꯐꯔꯦꯜꯒ ꯂꯥꯛꯄꯒꯤꯁꯤꯗ ꯁꯔꯉꯣꯟꯗ ꯀꯔꯤ ꯈꯪꯒꯦ ꯗꯥꯏꯕꯤꯇꯤꯁ ꯔꯦꯐꯔꯦꯜꯁꯦ ꯍꯦꯟꯒꯠꯂꯦ ꯅꯠꯇ꯭ꯔꯒ ꯊꯥꯛ ꯑꯃꯗ ꯂꯩꯌꯦ ꯁꯔꯒꯤ ꯃꯣꯠ ꯀꯔꯤ
Okay.
ꯂꯩ?
Okay. Thank you, Helen, and thank you, Sunil, Dr. Premsan, for allowing me to join such an important program. Manipuri da ngangu haibanina, and I start with Manipuri, right? But thing is, I in between, I may just breeze off with the English, like I do like. Diabetes haibasidi koida aduki matik common oire koi loina makhangnare. Incidence and prevalence is to the tune of around different states ta khara khena badi lai adubu around koina swaina hainarasi 11 to 12% si haina lobsi khwaidagi hena wangbasina goa da hena wangangkani hadi koigi state capital of diabetes haidna India da hype tardi koigi kano se goa da khwaidi hele na koi project tawe ba ko aduga koi Manipur su koi sum thengna jarakpada incidence is rising incidents new cases haibase hengalai hanadagi sum hengalai ni koina sum thengna jabda in clinical practice koina sum logjabada akoigi Manipur gi incidence and incidence prevalence haibatarabadi gina 14 faugi percentage ta legani hena aina ban lore aduga diabetes urakpugi maram tudi aina ngasidi yamna matam si ten gadawu male ꯂꯣꯝꯗ ꯂꯥꯛꯀꯗꯧꯕ ꯃꯥꯜꯂꯦꯕ ꯑꯗꯨꯕꯨ ꯃꯌꯥꯝꯅ ꯈꯪꯅꯕꯗ ꯑꯩꯈꯣꯏꯅ ꯂꯥꯏꯐ ꯁ꯭ꯇꯥꯏꯜ ꯆꯦꯟꯖ ꯇꯧꯔꯛꯄꯁꯤꯅ ꯃꯔꯝ ꯑꯣꯏ ꯍꯦꯟꯅ ꯃꯔꯨ ꯑꯣꯏꯗꯅ ꯂꯥꯏꯐ ꯁ꯭ꯇꯥꯏꯜ ꯆꯦꯟꯖ ꯇꯧꯔꯛꯄꯗꯒꯤ ꯑꯩꯈꯣꯏꯒꯤ incidence and the prevalence ꯍꯥꯏꯗꯤ obesity ꯍꯦꯟꯒꯠꯂꯛꯄꯗꯒꯤ insulin resistance ꯍꯥꯏꯗꯅ ꯀꯃꯥꯏꯅ ꯇꯧꯅ express ꯇꯧꯒꯗꯧꯅꯣꯗꯤ ꯑꯩꯁꯨ ꯈꯪꯗ꯭ꯔꯦ ꯃꯅꯤꯄꯨꯔꯗ insulin resistance ꯑꯩꯅ ꯁꯥꯡꯅ ꯇꯥꯛꯑꯕꯗ insulin ꯌꯥꯝ ꯗꯔꯀꯥꯔ ꯑꯣꯏꯕ status ꯑꯃꯈꯛ ꯍꯛꯆꯥꯡꯗ ꯄꯨꯊꯣꯛꯄ ꯑꯗꯨꯅ ꯃꯔꯝ ꯑꯣꯏꯔꯀꯥꯟꯗ ꯑꯩꯈꯣꯏꯅ ꯃꯔꯤ ꯁꯝꯅꯈꯤꯕꯗꯒꯤ ꯑꯩꯈꯣꯏ ꯁꯨꯒꯔꯁꯤ ꯍꯦꯟꯒꯠꯂꯛꯄꯅꯤ ꯍꯥꯏꯅ ꯂꯧꯗꯣꯏꯅꯤ ꯑꯩꯈꯣꯏꯅ ꯐꯥꯔꯁ ꯑꯣꯐ ꯑꯣꯜ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯍꯧꯔꯛꯄꯗꯗꯤ ꯑꯩꯈꯣꯏꯅ ꯀꯔꯤ ꯍꯥꯏꯒꯗꯒꯦ ꯍꯥꯏꯕꯗ ꯁꯤꯗꯦꯟꯇꯔꯤ ꯂꯥꯏꯐ ꯁ꯭ꯇꯥꯏꯜ ꯑꯁꯤꯅ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯊꯕꯛ ꯍꯥꯏꯗꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯨꯚꯃꯦꯟ ꯋꯥꯠꯄꯁꯤꯅ ꯑꯩ ꯈꯤꯇꯪ ꯁꯝꯖꯟꯒꯦꯀꯣ ꯑꯩꯅ ꯁꯨꯝ ꯈꯟꯕꯗ ꯅꯪꯒꯤ ꯃꯇꯝꯁꯦ ꯈꯤꯇꯪ ꯇꯦꯜꯂꯕ ꯃꯥꯜꯂꯤ ꯑꯗꯨꯅ
ꯌꯥꯅꯤ sir.
ꯑꯩꯅ ꯁꯨꯝ ꯉꯥꯡ ꯂꯩꯔꯗꯤ ꯃꯌꯥꯝꯁꯨ ꯑꯗꯨꯝ ꯑꯩꯅ ꯉꯥꯡꯕ ꯍꯧꯈ꯭ꯔꯀꯥꯟꯗ ꯑꯃꯨꯛ ꯂꯣꯏꯕ ꯅꯥꯏꯗꯅ ꯁꯨꯝ ꯉꯥꯡꯉꯛꯀꯥꯟꯗꯕ ꯑꯩ ꯈꯤꯇꯪ ꯁꯝꯃꯛꯀꯦ ꯑꯗꯨꯒ ꯇꯨ ꯗ ꯄꯣꯏꯟꯠ ꯉꯥꯡꯉꯛꯀꯦ ꯏꯟꯁꯤꯗꯦꯟꯁ ꯄ꯭रिꯚꯤꯂꯦꯟꯁ ꯑꯗꯒꯤ ꯑꯃꯨꯛ ꯀꯃꯥꯏꯅ ꯑꯣꯏꯔꯛꯀꯦ ꯍꯥꯏꯅ ꯍꯥꯏꯕ ꯇꯥꯔꯕꯗꯤ obesity ꯂꯥꯛꯑꯦ ꯑꯗꯨꯗꯒꯤ ꯍꯦꯟꯗꯣꯛꯄ obesity ꯈꯛꯇ ꯌꯥꯗꯦ BMI ꯈꯛꯇꯅꯁꯨ ꯍꯣꯠꯇꯦ ꯑꯩꯈꯣꯏꯅ BMI ꯍꯣꯠꯇ꯭ꯔꯅꯦ body mass index body mass index ꯁꯤꯁꯨ masculinity haina pura chumbadi nate adubo akoinadi phenotype ama khaidu eba truncal obesity mayai da pongbodo pug yam chawbodo ꯄꯨꯛ ꯌꯥꯝ ꯆꯥꯎꯕ ꯁ꯭ꯇꯦꯇꯁ ꯑꯃꯈꯛ ꯂꯩꯗꯅ ꯑꯩꯈꯣꯏꯅ ꯇ꯭ꯔꯪꯀꯜ ꯑꯣꯕꯦꯁꯤꯇꯤ ꯀꯧꯏ ꯀꯣ ꯇ꯭ꯔꯪꯀꯜ ꯑꯣꯕꯦꯁꯤꯇꯤ ꯍꯥꯏꯗꯤ ꯍꯛꯆꯥꯡ ꯄꯨꯟꯅ ꯆꯥꯎꯕꯗꯒꯤꯗꯤ ꯇ꯭ꯔꯪꯀꯜ ꯑꯣꯕꯦꯁꯤꯇꯤ ꯇꯧꯕꯗꯣ ꯑꯗꯨꯅ ꯍꯦꯟꯅ ꯔꯤꯛꯁꯅꯤ ꯍꯥꯏꯕ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯩꯅꯣꯁꯤꯗꯩꯁꯤꯗ ꯀꯩꯅꯣ ꯗꯥꯏꯕꯤꯇꯤꯁ ꯑꯣꯏꯍꯜꯂꯛꯄꯒꯤ ꯆꯥꯡꯁꯦ ꯁꯤꯒꯤ ꯀꯩꯅꯣꯁꯤꯗꯤ ꯅꯣꯏꯅ ꯑꯩꯉꯣꯟꯗ ꯀꯩꯅꯣꯒꯤ ꯌꯥꯝꯅ ꯃꯣꯂꯤꯀꯨꯂꯔ ꯂꯦꯚꯦꯜꯗ ꯆꯪꯈ꯭ꯔꯒꯗꯤ ꯌꯥꯝꯗꯤ ꯅꯨꯡꯉꯥꯏꯒꯗꯕ ꯀꯣ
ꯉꯁꯤꯅ
ꯑꯗꯣ
ꯀꯣꯃꯟ ꯄꯦꯃꯦꯟꯠꯁꯤꯡꯒꯤ ꯃꯦꯁꯦꯖ ꯄꯤꯅꯤꯡꯕꯒꯤꯀꯣ ꯁꯔ
ꯑꯗꯨꯅ ꯁꯨꯃꯥꯏꯅ ꯇꯧꯗꯅ ꯅꯣꯏꯍꯟꯕꯗꯤ ꯆꯨꯝꯗꯦ ꯕꯣꯗꯤ ꯃꯥꯁ ꯏꯟꯗꯦꯛꯁ ꯍꯥꯏꯕꯁꯦ ꯕꯣꯗꯤ ꯃꯥꯁ ꯏꯟꯗꯦꯛꯁ ꯍꯥꯏꯕꯁꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯩꯅꯣ ꯄꯥꯔꯥꯃꯤꯇꯔ ꯑꯃꯅꯤ ꯅꯣꯏꯕ꯭ꯔꯥ ꯅꯣꯏꯗꯕ꯭ꯔꯥ ꯍꯥꯏꯅ ꯈꯟꯕꯒꯤꯀꯣ ꯅꯣꯏꯍꯜꯂꯛꯄꯁꯦ ꯀꯗꯥꯏꯗꯒꯤ ꯑꯣꯏꯍꯜꯂꯛꯄꯅꯣ ꯍꯥꯏꯕꯗꯤ ꯑꯣꯕꯦꯁꯤꯇꯤ ꯍꯥꯏꯁꯦ ꯑꯩꯈꯣꯏꯅ ꯑꯦꯛꯖꯥꯝꯄꯜ ꯄꯤꯔꯕꯗ एनर्जी इम्बेलेंसनी है लवेबको एनर्जी इम्बेलेंस है इनटेक वर्सेस हाइदी चासनबदुगा अदुगा स्पेंड तौखिबा अखोइना मांगनखिबदुगा एनर्जी स्पेंड तौखिबदु अदुगी इम्बेलेंस दगी नि हाइना लौनरिबने हैबको ओबेसिटी हैबसे ओबेसिटी वंस लाआगदी अखोइना इंसुलिन रेजिस्टेंस हैब मखक लाए इंसुलिन रेजिस्टेंस हैब तारगदी इंसुलिन हक्सांगी बॉडी सिदा इंसुलिन की चांगसी याम हेली कोजिंग हाइपर इंसुलिनिमिया हैबसे हाइपर इंसुलिनिमिया लापु मतमददी अखोइगी से मार्कर मयाम थोकले मार्कर मयाम थोलपदगी अखोइना कमाय तौगे हैदा पेनक्रियास हैब ग्लैंड सिना इंसुलिन पुथोकदोइनिदना को इंसुलिन पुथोकपसे अहानबददी ngамममी तमना तमना इन ड्यू कोर्स ngамमक्ति है ngамमक्तरब मतमददी दे इज ए imbalance between hyperinsulinemia and हुजिकी पेनक्रियास की बीटा सेल सिंगसिना इंसुलिन पुथोकप ngambagi लेवल imbalance ama lakpa matungdadi kamai tauge sugar se body dagi dispose tau लौथोकप ngama aro है लौथोकप ngamdaba matamdudani akoina diabetes manifest tawisi aduga symptoms ti akoi mayam loi khangnaredana ko ising yamna chatpa ising yamna thakningba aduga chak yam chaningba yangdi kantharakpa yam sonjalakpa mit na nungairaktaba koina kare kare haitare choktharakpa mayam ama adumai tawdana lakani sina khitang ahanbagi samlakpa oige ko len ko hoi
yam nungaijare sir na diabetes maramda phajana explain tawbiduna akoisu khangdaba khara yam hena madamna matang asida khara diabetes tawrati pregnancy da kari impact leke mama machada mama da tungtungda kari thokpa khotpa adugi matangda kitang haibirodi.
Thank you, Dr. Helen, and thanks to the Prega team for giving me this opportunity to join in this talk on diabetes with pregnancy. Akoina diabetes haibase akoi sara chobana su fadana mayek sena haibigre masida akoina mama amadi macha tongan ba sigi diabetes with pregnancy sida akoina tholokpa complications singse akoina khaidokpa yai aduga mironbi ahanbada mironbi nupisingsi oina complications singse akoina haiba taragadi akoina sigi sisu amuk pregnancy gi manungda amadi akoigi labor events labor chatlaba manungda problem kari laiba adagidi mining kulingedana kari problem laiba smaina akoina khaidokpa yai aduga mirolingai manung sigi sida early pregnancy early stage dari miscarriage yamna toina thokali adagi adumu amuk khara chatharakanda preterm labor haibadi kanogi sigi nganna tha sudringaida yekpa horokpa kana angang poknaba hotnarakpa sigumagi problem adagi infections like ising yafam hoba adagi haksang thonggi infection thokpa si yam toina thokali sigi mathasida amu bp wangbagi bp wangkhalakpagi problem pre-eclampsia kaina khoina haine sigumba adagidi angang kanoda polyhydramnios adina ising henba adagi simyamjina complicate toraga maternal distress mama se warakpa sina amuka hena sigi problems na sum henjalaga ri koi eye problems mid ki problem kidney ki problem heart ki problem simyam se adum tholokpa yai during pregnancy adaga amuk sigi sina kano toraganda tha sujalakpa natraga labor chatlakpa kanda labor ki process dadi kamai togeda usually koi diabetes laiba miron bising se angang se ꯆꯥꯎꯒꯜꯂꯤ ꯑꯗꯨꯅ ꯑꯉꯥꯡ ꯆꯥꯎꯕꯗꯨꯅ ꯃꯔꯝ ꯑꯣꯏꯗꯨꯅ ꯂꯦꯕꯔ ꯆꯠꯄꯗꯁꯨ ꯄ꯭ꯔꯣꯂꯣꯡ ꯂꯦꯕꯔ ꯍꯥꯏꯗꯤ ꯂꯦꯕꯔꯗꯨ ꯈꯔ ꯍꯦꯟꯅ ꯁꯥꯡꯅ ꯑꯗꯨꯝ ꯋꯥꯅ ꯇꯧꯒꯟꯕ ꯍꯥꯏꯇꯥꯔꯦ ꯑꯗꯒꯤꯗꯤ ꯑꯃꯨꯛ ꯃꯀꯣꯛ ꯀꯩꯅꯣ ꯁꯄꯣꯁ ꯂꯦꯕꯔꯁꯅ ꯑꯦꯗꯚꯥꯟꯁ ꯑꯣꯏꯔꯒꯁꯨ ꯃꯁꯥꯒ ꯍꯣꯜ ꯕꯣꯗꯤꯁꯤꯒ ꯃꯥꯒꯤ ꯃꯀꯣꯛꯁꯤꯒ ꯗꯤꯁꯄ꯭ꯔꯄꯣꯔꯁꯅꯦꯠ ꯑꯣꯏꯗꯅ ꯀꯩꯅꯣꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯁꯣꯜꯗꯔꯁꯤꯗ ꯄꯟꯗꯅ ꯂꯩꯕ ꯁꯣꯜꯗꯔ ꯗꯤꯁꯇꯣꯁꯤꯌꯥ ꯍꯥꯏꯅ ꯍꯥꯏ ꯁꯤꯁꯤꯁꯨ ꯌꯥꯝ ꯊꯣꯛꯀꯜꯂꯤ ꯑꯗꯒꯤꯗꯤ ꯑꯃꯨꯛꯁꯨ ꯍꯛꯆꯥꯡ ꯊꯣꯡꯒꯤ ꯏꯟꯖꯨꯔꯤ ꯃꯃꯥꯗ ꯑꯗꯒꯤꯗꯤ ꯑꯉꯥꯡꯗꯨ ꯆꯥꯎꯔꯦ ꯀꯨꯏꯅ ꯄ꯭ꯔꯣꯂꯣꯡ ꯂꯦꯕꯔ ꯆꯠꯂꯦ ꯑꯗꯨꯑꯣꯏꯗꯤ ꯍꯌꯦꯡ ꯍꯣꯔꯦꯟ ꯄꯣꯛꯂꯛꯄꯗꯁꯨ ꯑꯃꯨꯛ ꯌꯦꯛꯁꯜꯂꯨ ꯌꯥꯗꯗꯅ PPH ꯍꯥꯏꯅ ꯏ ꯍꯥꯗꯕꯒꯤ ꯄ꯭ꯔꯣꯕ꯭ꯂꯦꯝꯁꯤꯃ ꯌꯥꯝꯅ ꯇꯣꯏꯅ ꯑꯗꯨꯝ ꯊꯣꯛꯄ ꯊꯦꯡꯅꯕ ꯄ꯭ꯔꯣꯕ꯭ꯂꯦꯝ ꯑꯃꯅꯤ ꯑꯗꯒꯤ ꯁꯤ ꯃꯌꯥꯝꯁꯤ ꯑꯉꯥꯡꯁꯦ ꯆꯥꯎꯔꯦ ꯑꯗꯒꯤ ꯄꯣꯛꯄ ꯉꯝꯃꯣꯏ ꯍꯥꯏꯅ ꯈꯜꯂꯒꯁꯨ ꯑꯃꯨꯛ CS ꯀꯤ ꯏꯟꯁꯤꯗꯦꯟꯁ ꯑꯣꯄꯔꯦꯇꯤቭ ꯏꯟꯇꯔꯐꯔꯦꯟꯁ ꯅꯠꯇ꯭ꯔꯒ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯈꯥꯗ ꯄꯣꯛꯑꯒꯁꯨ ꯈꯔ ꯍꯦꯟꯅ ꯀꯩꯅꯣ ꯑꯦꯄꯤꯖꯤꯑꯣꯇꯣꯃꯤꯒꯨꯝꯕ ꯆꯥꯎꯅ ꯄꯤꯕ ꯈꯣꯠꯄ ꯁꯤ ꯃꯌꯥꯝꯁꯤꯒꯤ ꯄ꯭ꯔꯣꯕ꯭ꯂꯦꯝꯁꯦ ꯑꯩꯈꯣꯏꯅ ꯑꯗꯨꯝ ꯊꯦꯡꯅꯩ ꯂꯦꯕꯔ ꯃꯅꯨꯡꯗ ꯗꯦꯟ ꯁꯤꯒꯤ ꯃꯇꯨꯡꯗꯗꯤ ꯑꯃꯨꯛ ꯃꯅꯤꯡ ꯀꯨꯜꯂꯤꯉꯩ ꯄꯣꯁ ꯗꯦꯂꯤꯚꯔꯤ ꯃꯅꯤꯡ ꯀꯨꯜꯂꯤꯉꯩꯒꯤ ꯁꯤꯒꯤ ꯃꯅꯨꯡꯁꯤꯗ ꯁꯦꯞꯁꯤꯁꯀꯤ ꯄ꯭ꯔꯣꯕ꯭ꯂꯦꯝ ꯁꯦꯞꯁꯤꯁ ꯌꯥꯝꯅ ꯀꯣꯃꯟ ꯑꯣꯏ ꯑꯗꯒꯤꯗꯤ ꯑꯃꯨꯛ ꯑꯉꯥꯡꯒꯤ ꯃꯕꯨꯛ ꯊꯟꯗꯕ ꯑꯉꯥꯡ ꯈꯣꯝ ꯊꯟꯗꯕꯒꯤ ꯄ꯭ꯔꯣꯕ꯭ꯂꯦꯝꯁꯤꯁꯨ ꯌꯥꯝꯅ ꯊꯣꯛꯀꯜꯂꯤ ꯑꯗꯒꯤ ꯑꯃꯨꯛ ꯁꯤꯒꯤꯁꯤꯅ ꯃꯃꯥꯒꯤ ꯑꯣꯏꯅ ꯑꯣꯏꯈ꯭ꯔꯦꯀꯣ ꯑꯗꯨꯒ ꯑꯃꯨꯛ ꯑꯉꯥꯡꯒꯤꯗ ꯑꯃꯨꯛ ꯑꯩꯅ ꯉꯁꯥꯏꯗꯒꯤ ꯍꯥꯟꯅ ꯄꯟꯈꯤꯕ ꯃꯥꯏꯀ꯭ꯔꯣꯖꯣꯃꯤꯌꯥ ꯍꯥꯏꯁꯦ ꯁꯤꯒꯤꯁꯤ ꯑꯉꯥꯡꯁꯤ ꯈꯔ ꯑꯗꯨꯝ ꯆꯥꯎꯒꯜꯂꯦ ꯁꯤꯁꯤꯅ ꯑꯃꯨꯛ ꯁꯤꯃ ꯂꯩꯈ꯭ꯔꯦ ꯑꯗꯒꯤꯗꯤ another very important thing the congenital malformation ꯁꯤꯒꯤ congenital malformationꯁꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯗꯥꯏꯕꯦꯇꯤꯁꯅ ꯉꯜꯂꯤꯉꯩ ꯑꯩꯈꯣꯏꯒꯤ ꯑꯣꯔꯒꯥꯅꯣꯖꯦꯅꯦꯁꯤꯁ ꯀꯌꯥ ꯍꯛꯆꯥꯡꯒꯤꯀꯌꯥ ꯁꯦꯝꯕꯒꯤ ꯄ꯭ꯔꯣꯁꯦꯁ ꯇꯧꯔꯤꯉꯩꯁꯤꯗ ꯗꯥꯏꯕꯦꯇꯤꯁꯅ ꯀꯟꯇ꯭ꯔꯣꯜꯗ ꯂꯩꯇ꯭ꯔꯒꯗꯤ ꯁꯤꯒꯤ ꯀꯟꯗꯤꯁꯟꯗꯨꯅ ꯑꯉꯥꯡꯒꯤ ꯀꯩꯅꯣꯒꯤꯁꯤꯗ ꯃꯃꯥ ꯄꯨꯛꯅꯨꯡꯒꯤꯁꯤꯗ ꯄ꯭ꯔꯣꯕ꯭ꯂꯦꯝ ꯒ꯭ꯔꯣꯁ ꯁ꯭ꯇ꯭ꯔꯛꯆꯔꯦꯜ ꯑꯕꯅꯣꯔꯃꯦꯂꯤꯇꯤꯁ ꯌꯥꯝꯅ ꯊꯣꯛꯀꯜꯂꯤ ꯁꯤꯅ ꯖꯦꯅꯦꯇꯤꯛ ꯑꯣꯏꯕ ꯑꯗꯒꯤꯗꯤ ꯅ꯭ꯌꯨꯔꯜ ꯇ꯭ꯌꯨꯕ ꯗꯤꯐꯦꯛ ꯍꯥꯏꯅ ꯂꯩ ꯀꯩꯅꯣ ꯀꯣꯛꯀꯤ ꯁꯥꯏꯖꯁꯦ ꯀꯣꯛꯀꯤ ꯀꯩꯅꯣꯁꯤꯗ ꯁꯔꯨ ꯀꯩꯅꯣꯁꯤꯒꯤ ꯀꯨꯌꯣꯝ ꯀꯨꯞꯄꯁꯦ ꯁꯤ ꯌꯥꯎꯗꯕ ꯑꯦꯅꯦꯟꯀꯦꯐꯦꯂꯤ ꯀꯥꯏꯅ ꯑꯗꯒꯤ ꯅ꯭ꯌꯨꯔꯜ ꯇ꯭ꯌꯨꯕ ꯗꯤꯐꯦꯛꯁ ꯃꯌꯥꯝ ꯑꯃ ꯂꯩꯔꯦ ꯍꯥꯔꯠꯀꯤ ꯀꯣꯟꯖꯦꯅꯥꯏꯇꯦꯜ ꯍꯥꯔꯠ ꯗꯤꯐꯦꯛꯁ ꯃꯌꯥꯝ ꯑꯃ ꯑꯗꯨꯝ ꯊꯣꯛꯀꯜꯂꯦ ꯀꯤꯗꯅꯤꯒꯤ ꯄ꯭ꯔꯣꯕ꯭ꯂꯦꯝ ꯑꯗꯒꯤꯗꯤ ꯊꯤꯕꯣꯡ ꯊꯤꯔꯤꯟꯒꯤ ꯍꯥꯏꯕꯗꯤ GI ꯒ꯭ꯌꯥꯁꯇ꯭ꯔꯣꯏꯟꯇꯦꯁꯅꯦꯜ ꯄ꯭ꯔꯣꯕ꯭ꯂꯦꯝ ꯃꯌꯥꯝ ꯑꯃ ꯑꯗꯨꯝ ꯑꯩꯈꯣꯏꯅ ꯊꯦꯡꯅꯩ ꯑꯗꯒꯤꯗꯤ ꯑꯃꯨꯛ ꯄꯣꯛꯏꯉꯩꯒꯤ ꯁꯤꯁꯤꯅ ꯑꯃꯨꯛ ꯀꯣꯟꯖꯦꯅꯥꯏꯇꯦꯜ ꯃꯥꯜꯐꯣꯔꯃꯦꯁꯟꯒꯤꯗ ꯂꯩꯈ꯭ꯔꯦ ꯑꯗꯒꯤꯗꯤ ꯑꯉꯥꯡ ꯆꯥꯎꯕꯅ ꯁꯤꯅ ꯃꯔꯝ ꯑꯣꯏꯗꯨꯅ ꯅꯣꯔꯃꯦꯜ ꯄꯣꯛꯄ ꯀꯥꯟꯗꯁꯨ ꯑꯩꯈꯣꯏꯒ ꯕꯔth ꯏꯟꯖꯨꯔꯤꯁ ꯀꯩꯅꯣꯒꯤ ꯃꯌꯥꯝ ꯑꯃ ꯑꯗꯨꯝ ꯊꯦꯡꯅꯕ ꯌꯥꯎꯏ ꯑꯗꯒꯤ ꯑꯗꯣ ꯑꯩꯈꯣꯏꯅ ꯗꯥꯏꯕꯦꯇꯤꯁ ꯉꯥꯛꯇꯁꯤꯗ ꯑꯩꯈꯣꯏꯅ ꯑꯉꯥꯡ ꯆꯥꯎꯏ ꯉꯥꯛꯇ ꯍꯥꯏꯕꯁꯨ ꯌꯥꯗꯦ ꯄ꯭ꯔꯣꯕ꯭ꯂꯦꯝꯁꯤꯅ ꯄ꯭ꯔꯤ ꯑꯦꯀ꯭ꯂꯦꯝꯁꯤꯌꯥꯒꯨꯝꯕ ꯀꯣꯝꯄ꯭ꯂꯤꯀꯦꯇꯦꯗ ꯌꯥꯝꯅ ꯑꯣꯏꯔꯛꯑꯒꯗꯤ ꯁꯤꯗꯒꯤ ꯒ꯭ꯔꯣꯠ ꯔꯦꯁꯇ꯭ꯔꯤꯛꯁꯟ ꯑꯉꯥꯡ ꯄꯤꯛꯄ ꯆꯥꯎꯖꯟ ꯊꯤꯕ ꯁꯤꯁꯨ ꯑꯗꯨꯝ ꯊꯦꯡꯅꯗꯕ ꯅꯠꯇꯦ ꯑꯗꯒꯤ another very important point ꯑꯃ ꯑꯩꯈꯣꯏꯅ ꯀꯟꯁꯤꯗꯔ ꯇꯧ ꯇꯥꯔꯒꯗꯤ sudden fetal death ꯏꯈꯪ ꯈꯪꯍꯧꯗꯅ ꯑꯉꯥꯡꯁꯦ ꯀꯩꯁꯨꯝꯇ ꯀꯩꯅꯣ ꯇꯧꯔꯝ ꯑꯩꯈꯣꯏꯅ ꯁꯨꯝ ꯃꯣꯅꯤꯇꯔ ꯇꯧꯔꯒ sudden fetal death ꯑꯁꯤꯁꯨ ꯑꯗꯨꯝ ꯊꯦꯡꯅꯩ ꯑꯗꯨꯅ ꯑꯩꯈꯣꯏꯅ ꯃꯥꯒꯤ expected ꯇꯥꯔꯤꯛ ꯏꯗꯤꯗꯨꯗꯒꯤ ꯀꯌꯥ ꯍꯦꯟꯗꯣꯛꯇꯕꯤꯗ ꯁꯤꯗꯒꯤꯕꯨ ꯍꯦꯟꯅ ꯉꯟꯅ ꯑꯩꯈꯣꯏꯅ ꯄ꯭ꯔꯦꯒꯅꯦꯟꯁꯤꯁꯦ ꯇꯔꯃꯤꯅꯦꯠ ꯇꯧꯅꯕ ꯍꯥꯏꯅ ꯑꯗꯨꯝ ꯍꯣꯠꯅꯩ another point after delivery ꯁꯤꯗꯅ ꯀꯔꯤ ꯇꯧꯒꯦ ꯍꯥꯏꯕꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯍꯦꯛ ꯄꯣꯛꯄ ꯂꯣꯏꯕꯒ hypoglycemia ꯑꯉꯥꯡꯁꯦ hypoglycemia ꯆꯠꯄ respiratory distress syndrome ꯆꯠꯄ ꯑꯗꯒꯤꯗꯤ jaundice ꯅꯥꯔꯛꯄ ꯑꯗꯒꯤ calcium ꯋꯥꯠꯄ hypocalcemia hypomagnesemia ꯁꯤ ꯃꯌꯥꯝꯁꯤꯒꯤ ꯄ꯭ꯔꯣꯕ꯭ꯂꯦꯝꯁꯦ ꯑꯗꯨꯝ ꯊꯦꯡꯅꯩ ꯁꯤꯒꯤ ꯃꯃꯥ ꯑꯃꯗꯤ ꯑꯉꯥꯡꯗ ꯍꯥꯏꯗꯤ ꯗꯥꯏꯕꯦꯇꯤꯁꯅ ꯃꯔꯝ ꯑꯣꯏꯗꯨꯅ a whole lot many problems we face
ꯌꯥꯝ ꯅꯨꯡꯉꯥꯏꯔꯦ ꯃꯦꯗꯝꯅ ꯐꯖꯅ ꯄ꯭ꯔꯦꯒꯅꯦꯟꯁꯤꯁꯦ ꯗꯥꯏꯕꯦꯇꯤꯁ ꯅ ꯀꯣꯝꯄ꯭ꯂꯤꯀꯦꯠ ꯇꯧꯔꯛꯑꯗꯤ ꯑꯟꯀꯟꯇ꯭ꯔꯣꯜ ꯇꯧꯔꯛꯑꯗꯤ ꯀꯌꯥꯃꯨꯛ ꯃꯃꯥ ꯃꯆꯥꯗ ꯋꯥꯍꯟꯒꯦ ꯍꯥꯏꯕꯁꯦ ꯐꯖꯅ ꯃꯦꯗꯝꯅ ꯑꯦꯛꯁꯄ꯭ꯂꯦꯟ ꯇꯧꯕꯤꯔꯦ ꯑꯗ ꯗꯣꯛꯇꯔ ꯁꯥꯗꯥꯗꯒꯤꯁꯨ ꯑꯣꯄꯤꯅꯤꯌꯟ ꯈꯔ ꯂꯧꯖꯒꯦ ꯁꯤꯁꯤꯅ ꯈꯨꯗꯛꯇ ꯃꯤꯔꯣꯟꯕꯒꯤꯗ ꯀꯟꯇ꯭ꯔꯣꯜ ꯇꯧꯍꯧꯗꯕꯒꯤ ꯄ꯭ꯔꯣꯕ꯭ꯂꯦꯝ ꯑꯣꯏꯔꯦ ꯇꯨꯡꯗꯁꯨ ꯀꯔꯤ ꯄ꯭ꯔꯣꯕ꯭ꯂꯦꯝ ꯊꯣꯛꯄ ꯌꯥꯒꯦ ꯃꯃꯥ ꯍꯥꯏꯔꯣ ꯃꯆꯥ ꯍꯥꯏꯔꯣ ꯁꯨꯃꯥꯏꯅ इवेंटफुल डायबिटीज तौरगा प्रेगनेंसी के तौबदा तुंगदा प्रॉब्लम थोपा याबा कई लैगे
very good question angang diabetes angang pokre loigre haina akoina chumna laithokningai leite ꯄꯣꯛꯈ꯭ꯔꯕ ꯃꯇꯨꯡꯗ ꯃꯃꯥꯗ ꯀꯔꯤ ꯑꯣꯏꯔꯛꯄ ꯌꯥꯏ ꯃꯆꯥꯗ ꯀꯔꯤ ꯑꯣꯏꯔꯛꯄ ꯌꯥꯏ ꯍꯥꯏꯕꯁꯤ ꯌꯥꯝꯅ ꯃꯨꯟꯅ ꯈꯟꯅꯃꯤꯟꯅꯕ ꯑꯃ ꯗꯔꯀꯥꯔ ꯑꯣꯏꯀꯣ ꯑꯗꯨꯅ ꯃꯁꯤ ꯄꯣꯛꯈ꯭ꯔꯕ ꯉꯁꯥꯏ ꯏꯆꯦ ꯔꯠꯅꯥꯅ ꯍꯥꯏꯕꯤꯈ꯭ꯔꯦ ꯑꯗꯨꯃꯥꯏꯅ ꯄꯣꯛꯈ꯭ꯔꯕ ꯃꯇꯨꯡꯗꯐꯥꯎꯗ ꯃꯃꯥꯁꯤ complication diabetes haibasi diabetes haisi sugar dina e cheliba mafam khudimaka soktoribani aduna masina heart ta kidney da mid ta loinabak sokpa yai se ratna pandigre adumai tawdana pokhraba matungda miron bi amana mada diabetes oiraba pregnancy manungda adu retadi mathanggi pregnancy da amuk saruk ama ahumlak there is more chances of getting diabetes amuk hana mathanggi pregnancy so oiningai lei aduga maduda su natana mahagna kalumba pregnant oidraga su magi punsida mase type 2 diabetes oibagi chances yamna lei aduga diabetes oiragadi ngasi akhoi loina khangnaraba wa ba ngakani diabetes oiragadi mitta soi heart ta palai bp su lai kidney palai masi mayamsi thengagani aduga mironbina amukhana diabetes oiragadi cesarean section wangbana maram oiduna haidi moise ese marakna na su pandigre cesarean resu wangali kaigino da moise angang achobo yam oiganbanina mathangda su angang do hena chawba hena cesarean gi dakar oibagi abagi wafam amasu lei masina mamagi complication oigre aduga anisubada angang da kari sokpa yai diabetes oiba mamana pokla angang sinsina hek pokla di fazana care tawbirani akoina tawnariboba masina angang du sugar yengdana khotana tawre adubu angang da long term kari effect lege haibase yam pakna study di yam leitri adubu thengnaba amana diabetes oiba mamana pokthorapa angang sinse diabetes oibagi chances lei amadi loina na moise heart ki problem lakpasu yai amadi moise yamna noiganlagadi ngasai sar achobana ahawada haibiriba mind punamak ase noi chasalaga lengdabadagi ngasagi akogi insulin resistance adu thoklaaga diabetes adu tholakpani haidana haibigre sumna diabetes mamana polakpa machasu noiganbo oibanina masisira fazana control ta hogragadi makoju diabetes oidana laina puna chinapagi chances yamna lei haina haijani
Yang mengajar Dr. Tata long term complications sai kasi fazan explain tawbirabnina tungtungda mironbi
Helen
sir kari haige sir yang
sigise marak sum khara sum thelak pa ya gadra
yang nungaye sir khara thelak piyo sir adu taja ke
okay ratna ki choi tajare sada ki choi tajare santagi wali ko aina ngasai ki angang si maternal diabetic haibani ko mama se diabetic oiba aduga macha se orak yaba haiba mak lei heba adu natagana parents animal diabetes oiba machadana orak yabagi possibility su kayam yamba haibasu khara di literature da leiba ko aduna mama khaktang oiba angang na future da poiba polak iba angang sigi oiba yaba lifetime possibility of being type 2 diabetes niko type 1 ate we are not considering type 1 diabetes kanoda akoina type 2 diabetes orakpa yabagi possibility se lifetime da 40% ni haina lawsi hadi yamdra yamiko yame aduga both parents diabetic orabadi poglaiba angang duna diabetes orakpa yabagi changse hena yai 50-60% lifetime oiba ya hebako sigi phenomenon si noina di genetic yamna changhan di hai just kanoda mina khangba yaba kata ngang modi haiba adubu akhoi gi medical fraternity mayam si su khangmi na gadaba amana genetic nate sigi se genetic nate ba we call it as epigenetic ko hai
okay sir
epigenetic neba environment amaka bad environment amada expose tawkiduna epigenetic change kawe because sigi se aduna akoina kana tabu matamda angang se miron ba mama sina masa se angang oringadagi sum conception dagi ngasai gi kanuna haibdo organogenesis gi thinga kanda kana tawena hai khidna ko kana ratna so it's all loi chumme ba ko loi chum doi ni kai gina these are all epigenetic phenomena ka we ba ko genetic nate mayam na genetic ne na lobu ta ba ni ko remedy amadi lai pham di thoi dana natra
Yes,
remedy
sir.
question next set of questions wali branangi do
Oh, sir is answering my next question. Environmental factors hangani sir hujik epigenetic ki wari se dum la e hai na khalle sir adin
okay
ai na
okay
kitang hapsan ho ge sir. Changing
sum
lifestyle hai se
ada
sir
tam
hai
tam na koina kanogi discussion ki type to chat pasu yadi ai ko
discussion ne
nangi
sir. Oh.
discussion habidi one ai ngange ratna ngange sada ngange santa will be speaking santa tam tam mai magi part ti oida ba maliko
Oye,
oi
oye,
han
sir, oye, halli sir, dum hai biyo sir, gida chap chare tanja do, hujik sir na
okay okay
epigenetic factor explain
kanoni
tore.
hoi 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 ya aduna like oirakpa yabagi kano se obesity oibagi ngasai gi kano na sada na so haigre aidi obesity ti am based awi kano se ai outlook hai tare obesity ti am based awi aduna puglei bangang si epigenetic change lakpadagi or nang ngasai environmental factor lakpa matada ai khumge ba ko to the
Okay.
extent I understand ado ai dum khumna bo hanage ado kano gi loina mak noirakani except in few populations like Canada, Ananda, Masai Kanuna Pankibido, Microsomia Natanate ko, prematurity have actually have a ko,
Yes, sir.
Canada, flavor, Singida. Long term complications, Haitaradi, Nasagi Duna, short term complications, Kralai, soldier dystocia, then the increase, Kanogi. Kay haitare instrumental delivery gi chang henba si mayam sina hypoglycemia sina short term complications ni long term complications haitaradi obesity and adugi matungda lakpa consequence in dunia bako adubuga amana child born to mother of diabetes which specifically kanoda hena maru oina diabetes tightly control ta hok the mother na polpa angang singsigi neurodevelopmental defect lay have not only neural tube defect neural tube defect aisina structural ne have ko aduga nataba cognitive function of baby born to mother haidi mama diabetes especially diabetes fazana control ta hok da kambu se dadi magi cognitive function se low oi hena su adum su lei re that is long term complication kuina sathara pumutam da ko yai swain tum ai marapatta sum khara sum thelake ka okay
Sir, yam nungaizare, sir da hangi hai badu sir nahan question anticipate tawraga khumbiba ki yam nungaizare. Adu sir gi sir gi perspective ama tangsu hai hoge hang hoge ne. Sir apoi se sir na ngasai hai re increasing trend le hai na ko sir gi OPD da la ise gestational diabetes se. Sir gi OPD da increasing trend u hai re the sir lifestyle obviously western lifestyle da di he na asi se phazana ure but akwai swaidadi thabak inkhang tauba haibase hoi kharabudi handaramani thaina dauna di tawdre ko but chaba thappada akoina chak chabagi habit then akoigi maitai cheng am hau kraba cheng se akoina give up tawba ngamdaba adu factor di thaina mi ki su chali adu hujiki mi su same chai adu karigi maling kari matlab asi factor se maru oibra haina khanra sir
maru
koi
maru
manipur
ya moi
scenario da
ado ngasigi sabagi haitaradi I will supplement I supplement adum tawjarake bako
yai sir
ahan bada I have the answer I answer adum laigani hujiktane matangi kanoda sadada chabagi dongta hana
oh sada na khumhalase
nate
okay
kanoda
okay
nate santada
santa hai bas sir sada so yes khatang hoiba gine sau ya de sada su santa su
santada ongta nangko
santa kai khange hujik aina sada hangi bado
Okay. ꯑꯩꯅ ꯈ꯭ꯋꯥꯏ ꯐꯥꯔꯁꯇ ꯍꯥꯏꯅꯤꯡꯕꯗꯤ ꯍꯧꯖꯤꯛꯀꯤꯗꯨꯁꯨ ꯈꯨꯝꯖꯒꯦꯀꯣ ꯑꯗꯨꯒ ꯑꯩꯒꯤ ꯏꯟꯁꯥꯏꯠ ꯍꯥꯏꯇꯥꯔꯦ most of the kind of cases diabetes or any complication pregnancy matungda lakpa sisingse pregnancy matamda sisingse most of the time akoi sidadi pregnancy haiba conception tawbase accidental oyeba pre plan oiraga ai conceive tawrage ai plan tawraga pregnant kanu oige haibasi most of the time tawna de aduduna anambana check tawthokta ko adugumbana anamba complications se lakne haijeninge aduga ngasai gi diet ki maram da haragadi cheng thaina zu adum cheng afaba yamna chai hauji su chai but lifestyle sedentary lifestyle hojikna hele adagidi complication mayam sinna maram oiraga leng otpa yade na hadi complication labor khara leng otpa yade na thambagumba ko adagidi mainly lifestyle change tawba haitare sisina factor ama oyena khalle aduga diabetes se akoina initial stage haitare ai adum continue tawba yai ko
yani Santa hai.
at the initial stage tadi ngasai gi diabetes se akoina diet sina adum control tawba ngame but diabetes se most of the time cure tawbadi shongamde mai di manage tawba control tawba chang amada lehanba sine yam darkar oirise control tawhanba ko aduduna initial stage da mi kharana high diabetes diet chaba thakpa si ka aga hidak cha su ya adegi mithi maru thaga adegi mana masing thaga si maru je phutla thaga si diabetes control taw for some time control taw dinga me there are superfood or functional foods so haine ado moi simak na cure taw halle haibadi natte aduna
Laina se
diabetes
control
control
thamba hai.
control da thamna bai da makta ngasai gi chinjak hidak amasung hakchang sajen medication diet and exercise ahummak se tuna chatlakanda da ne ngasai sugar se control tawba ngamtoise aduduna aidi hidak chare na chaba thakpa lai thokpa su yade adegidi aidi chaba da ka inena restriction pangtaw da tawraga ngasai balance diet cha da with the hidak cha roi kaina adumaina tawba su yade aduna chinjak su restriction in the sense ngasai aina akoina haiba balance diet hai tare ngasagi vitamin mineral yauba pot adagidi mahai marong oiro haira oiro protein adequate oina chaba masigi nutrients se suna chaba balance diet oina chaba sini yam darkar oirise aduga portion control tawba phai haiba pot su yam chasan biba phate adagidi phate na restrict pang taw
samna da healthy eating haiduni natra
mane sir healthy eating haibadune
healthy eating haiduni
But people tend to get carried away with the term healthy eating, sir. Healthy eating has lots of nuts and complication of eating those nuts.
adune farabane na yerum no mada example oina yerum tare ni pancha saladi abu kadana nushit kadana tumuidone ba aduna ngasai gi maru already portion control tawba balance diet chaba maduni am darkar already chang amada chaba ko adagidi machioi bachinjak chaba matam naina chaba masini am darkar oidi se khona diabetes control tawbada aduna akoina small frequent meals hai tare khajik khajik chaba toina chaba masini yam darkar oirise amukta yam chasalaga puk yam kuina hanghalaga amuk khangcha chasanba masi yam phate diabetes control tawbada yamna wana thoi sum tabo akoi sigi chanabi oina hajikandi breakfast se adum khara breakfast chabagi habit lere but akoi di chak ayuki chak chaba se brunch oina hai tare sina main oina chaiba aduga nudin talak sina cha thaga thae natraga di nungdang chak chari sina sigi 2 meals main meal si sineba anamba khoige population sina chanari se adu masigi habits diabetes lai haiga di masigi habits se khara thairaga koina sagi meals break to bi ba hai tare chakti ayuki nungdangi ani chari sina yare marak talak se sida akoina sum tabu 2 to 3 hours ki interval da bu oire chakcha toga pung ani mule kana sema ma chasanba adai pung ani humule kana yirum aputo egg white ama chasanba again 2 to 3 hours le kanda salad kumba khara chaba adumain torga 2 to 3 hours ki gap ta toina small frequent meals chaba sina diabetes control to sugar control to hanbada yamne helpful oi aigi experience da aduna masi mayamna su kano tawhaninge adagi amana ngasai GDM sida focus tawraga most of the time akoina hek patient se thengnaba da keno se gestational diabetes te pregnancy matam da leiraga angang deliver tawra matung da di normal leire na hek laithok pa hai tare pregnancy matam da di ma se strictly follow tawraga mi myamna madi deliver tawradi phabani na sugar normal da lakpani na haina bagi masana laithokpa aduna recurrence se 2 years tazu 5 years tazu 10 years tazu adum recur torokpa yabagi high chance layeba aduna once adumaina GDM laikhra tardi after delivery dasu masi yamna careful oibiba ma darkar oi aduna akoigi tradition oina hai tare China digi chanarak poina akoi macha pokpina kenogi chak chapu thongaga aluga thumga nga ayaiba nga akangbadang chaba ko
High calorie
adagidi
diet.
isinga se one time thakadabni marakta thakpa yade kainaga
Oh.
haiba sigi thingse kitang change tawba ama darkar oi for some time at least 1-2 months kumbagi da ko gastric problem lairoidaba pot ngasai spicy oiba ko oily oiba sigumba singzidi khara avoid tawbiba aduga protein yawa pot ngasai chicken oire nga oire egg oire hawai oire si loinamak chaba yai even fruits adum 1 month 30 days mukki matungda adum chaba yai mayamna di hainai mapan lamdadi adum macha popo
Chai.
loibaga juice kumba thae then kaino da fruits kumba su dum pijaye but aina haijaning badi mapan gi na mapan oir akoi shiga weather se mana deba mapan gi weather ga akoi shigi weather siga khara chana de aduna ngasai gi akoi gi traditional way du su khara follow to darkar oi because I have um come across some incidents like moina adumaina post delivery juice thakpa yaina thawbdai riger laktana tawba thengnare aduduna akhoi sigi weather siga chana daba oibanina dugumba yamna sinba yamna ingba pot kumba ko adagi yamna spicy oiba pot sigumba sidi yari kai matam khara kakpibana phai aduga chamna thongba pot loinamak enjang napi oiro ko adagidi protein rich diet loinamak chaba yai loinamak chaba darkar oi si haijangi aina
Oh,
Good,
okay.
good, good.
ꯃꯇꯥꯡꯁꯤꯗ Dr. Helen ꯃꯇꯥꯡ ꯑꯃꯇꯪ ꯂꯧꯖꯔꯒ ꯑꯩ ꯍꯥꯏꯖꯅꯤꯡꯉꯤ this is for the Manipur population particularly ꯑꯩꯈꯣꯏꯒꯤ Dr. ꯁꯥꯟꯇꯅ ꯍꯥꯏꯔꯤꯁꯤ ꯌꯥꯝ ꯆꯨꯝꯃꯦ ꯆꯥꯕ ꯂꯣꯏꯔꯦ ꯃꯐꯝ ꯊꯣꯛꯈ꯭ꯔꯦ ꯄꯣꯛꯊꯣꯛꯈ꯭ꯔꯦ ꯂꯣꯏꯔꯦ ꯐꯔꯅꯤ ꯍꯥꯏꯕꯒꯤ ꯃꯑꯣꯡꯗ ꯄꯨꯡꯆꯥ ꯆꯥꯅꯤꯡꯉꯤ ꯆꯥꯅꯤꯡꯕꯁꯨ ꯄꯣꯛꯏ ꯑꯁꯦꯡꯕꯗ ꯍꯥꯏꯔꯒꯗꯤꯀꯣ ꯑꯗꯨꯕꯨ ꯃꯁꯤꯗꯩꯁꯤꯗ ꯑꯩꯈꯣꯏꯅ ꯗꯤꯂꯤꯚꯔꯤ ꯂꯣꯏꯔꯕ ꯃꯇꯨꯡꯗ ꯂꯣꯏꯅꯔꯤꯕ ꯗꯥꯛꯇꯔꯁꯤꯡꯗꯨꯗ ꯀꯔꯤ ꯆꯥꯕ ꯌꯥꯒꯦ ꯍꯤꯗꯥꯛꯇꯨꯕꯨ ꯆꯥꯊꯒꯣ ꯍꯥꯏꯕ꯭ꯔꯥ ꯆꯥꯊꯒꯅꯨ ꯍꯥꯏꯕ꯭ꯔꯥ ꯂꯦꯞꯄꯁꯨ ꯌꯥꯔꯕ꯭ꯔꯥ ꯍꯥꯏꯕꯁꯦ ꯌꯨꯝ ꯗꯤꯂꯤꯚꯔꯤ ꯃꯇꯨꯡꯗ ꯌꯨꯝ ꯆꯠꯇ꯭ꯔꯤꯉꯩꯗ ꯄꯦꯁꯦꯟꯁꯤꯡꯅ ꯐꯖꯅ ꯍꯪꯕꯤꯕ ꯃꯁꯤꯃ ꯗꯔꯀꯥꯔ ꯂꯩꯔꯦꯀꯣ ꯑꯗꯨꯒ ꯗꯥꯛꯇꯔꯗꯨꯅ ꯌꯥꯔꯦ ꯈꯣꯠꯂꯦ ꯍꯥꯏꯔꯦ ꯆꯥꯊꯈꯤꯁꯤ ꯍꯥꯏꯕꯒꯤ ꯃꯇꯨꯡ ꯏꯟꯅ ꯆꯥꯊꯔ ꯃꯇꯨꯡꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯩꯅꯤꯡ ꯀꯨꯝꯃꯤꯉꯩꯒꯤ 6 weeks ꯍꯥꯏꯇꯥꯔꯗꯤ ꯊꯥ ꯃꯈꯥꯏꯗ ꯗꯥꯏꯕꯦꯇꯤꯁꯀꯤ ꯇꯦꯁꯁꯦ ꯑꯃꯨꯛ ꯇꯧꯊꯣꯛꯑꯒ ꯃꯥꯁꯤ ꯃꯈꯥ ꯇꯥꯅ ꯆꯥꯊꯒꯗ꯭ꯔꯥ ꯆꯥꯊꯔꯣꯏꯗ꯭ꯔꯥ ꯍꯥꯏꯕꯁꯤ ꯑꯃꯨꯛ ꯈꯪꯗꯧꯔꯤꯕꯅꯦꯕ ꯑꯗꯨꯅ ꯗꯥꯏꯕꯦꯇꯤꯁ ꯑꯉꯥꯡ ꯄꯨꯛꯅꯨꯡꯗ ꯂꯩꯔꯤꯉꯩꯗ ꯑꯣꯏꯕ ꯗꯥꯏꯕꯦꯇꯤꯁꯇꯨ ꯀꯣꯟꯅ ꯂꯩꯔꯤꯕ꯭ꯔꯥ ꯂꯩꯇ꯭ꯔꯤꯕ꯭ꯔꯥ ꯍꯥꯏꯕꯒꯤ ꯆꯦꯛ ꯇꯧꯕ ꯑꯃ ꯃꯊꯧ ꯇꯥꯏ ꯍꯥꯏꯕꯁꯦ ꯃꯌꯥꯝꯗ ꯍꯥꯏꯖꯅꯤꯡꯉꯤ ꯊꯥ ꯃꯈꯥꯏ ꯐꯣꯂꯣ ꯑꯞ ꯊꯥ ꯃꯈꯥꯏ ꯁꯨꯔꯛꯄꯁꯤꯗ ꯑꯉꯥꯡꯗ ꯃꯩꯅꯤꯡ ꯀꯨꯝꯕꯒꯤ ꯇꯪꯈꯥꯏ ꯆꯠꯂꯛꯄ ꯍꯥꯏꯇꯥꯔꯦꯀꯣ ꯊꯥ 3 ꯑꯣꯏꯕꯅꯤ나 ꯗꯥꯛꯇꯔꯗ ꯑꯃꯨꯛꯇꯪ ꯆꯦꯛ ꯇꯧꯊꯣꯛꯑꯣ ꯁꯨꯒꯔ ꯇꯦꯁꯁꯦ ꯇꯧꯊꯣꯛꯃꯤꯟꯅꯁꯤ ꯑꯗꯨꯒ ꯑꯩꯈꯣꯏꯒꯤ ꯗꯥꯏꯕꯦꯇꯤꯁꯇꯒꯤ ꯂꯥꯛꯀꯗꯧꯕ ꯗꯥꯏꯕꯦꯇꯤꯁꯇꯒꯤ ꯍꯥꯏꯗꯤ ꯗꯥꯛꯇꯔ ꯁꯟꯇꯥꯅ ꯍꯥꯏꯕꯤꯒꯤ ꯑꯗꯨꯃꯥꯏꯅ ꯐꯖꯅꯕꯨ ꯆꯤꯟꯖꯥꯛꯄꯨ ꯐꯖꯅ ꯆꯥꯔꯕ ꯃꯆꯦꯠ ꯃꯆꯦꯠ ꯑꯣꯏꯅ ꯆꯥꯡ ꯅꯥꯏꯅ ꯆꯥꯔꯒꯗꯤ ꯉꯥꯛꯊꯣꯛꯄ ꯉꯝꯃꯤ ꯀꯟꯇ꯭ꯔꯣꯜ ꯇꯧꯕ ꯉꯝꯃꯤ ꯍꯥꯏꯕꯒꯤ ꯂꯩꯕꯅꯤꯅ ꯑꯩꯈꯣꯏꯅ ꯃꯁꯤ ꯑꯃꯨꯛꯇꯪ ꯐꯖꯅ ꯇꯧꯃꯤꯟꯅꯁꯤ ꯆꯦꯛ ꯇꯧꯕꯒꯤ ꯂꯣꯏ ꯄꯣꯛꯈ꯭ꯔ ꯃꯇꯨꯡꯗꯁꯨ ꯑꯗꯨꯝ ꯇꯧꯁꯤ ꯍꯥꯏꯕꯒꯤ ꯋꯥꯐꯝ ꯑꯁꯤ ꯊꯝꯖꯅꯤꯡꯉꯤ
ꯑꯩ ꯑꯝꯇꯪ ꯏꯟꯇꯔꯚꯤꯌꯨ ꯇꯧꯖꯔꯛꯀꯦ
No,
Helen?
sir. It's not an intervention. You're always welcome, sir. Yes, sir.
ꯀꯩꯅꯣꯒꯤ scientific basis ꯆꯪꯒꯅꯣꯗꯤ ꯍꯥꯏ ꯑꯗꯨꯕꯨ ꯑꯩꯗꯨ ꯀꯔꯤꯝ ꯀꯥꯟꯗ ꯍꯦꯛꯇ ꯆꯪꯅꯤꯡꯉꯛꯏ ꯁꯥꯟꯇꯅꯁꯨ ꯍꯥꯏꯈ꯭ꯔꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯆꯦꯠ ꯃꯆꯦꯠ ꯆꯥꯎ ꯍꯥꯏꯕꯒꯤ ꯀꯩꯅꯣꯁꯤ ꯃꯔꯝꯁꯤ ꯀꯔꯤꯒꯤꯅꯣ ꯍꯥꯏꯕꯕꯨ ꯄ꯭ꯔꯤ ꯗꯥꯏꯕꯦꯇꯤꯁ ꯍꯥꯏꯕꯁꯤ will become diabetes ꯑꯣꯏꯔꯛꯀꯅꯤ ꯑꯗꯨꯒ GDMꯁꯨ diabetes ꯑꯣꯏꯔꯛꯄꯒꯤ ꯆꯥꯟꯁꯁꯦ ꯑꯗꯨꯛꯀꯤ ꯃꯇꯤꯛ ꯌꯥꯝꯅ ꯋꯥꯡꯈ꯭ꯔꯦ in the future ꯃꯇꯨꯡꯗꯀꯣ ꯑꯗꯨꯅ ꯑꯩꯈꯣꯏꯅ ꯕꯔꯗꯟꯁꯦ ꯀꯗꯥꯏꯗ ꯄꯤꯒꯦ ꯍꯥꯏꯗ ꯕꯤꯇꯥ ꯁꯦꯜꯁꯇ ꯄꯤ ꯄꯦꯟꯀ꯭ꯔꯤꯌꯁꯇ ꯌꯥꯝꯅ ꯍꯦꯚꯤ ꯃꯤꯜ ꯆꯥꯕ ꯅꯨꯃꯤꯠꯁꯦ ꯄꯦꯟꯀ꯭ꯔꯤꯌꯁ ꯕꯤꯇꯥ ꯁꯦꯜꯗ ꯍꯦꯚꯤ ꯕꯔꯗꯟꯅꯤ ꯑꯗꯨꯅ ꯁꯨꯃꯥꯏꯅ ꯇꯧꯗꯅ ꯍꯦꯚꯤ ꯕꯔꯗꯟ ꯑꯃꯨꯛ ꯇꯧꯕ ꯑꯃꯨꯛ ꯂꯣꯡ ꯒꯦꯞ ꯑꯃꯨꯛ ꯊꯝꯕ ꯃꯔꯛꯁꯤꯗ ꯋꯥꯟ ꯇꯥꯏꯝ ꯏꯠꯁ ꯑꯦ ꯕ꯭ꯂꯣ ꯄꯦꯟꯀ꯭ꯔꯤꯌꯁꯇ ꯕ꯭ꯂꯣ ꯑꯃ ꯄꯤꯔꯤꯅꯤ ꯕꯤꯇꯥ ꯁꯦꯜꯁꯤꯡꯁꯤꯗ ꯊꯤꯟꯖꯟꯕ ꯑꯩꯈꯣꯏ ꯀꯩꯅꯣꯗ ꯈꯣꯏ ꯃꯌꯨꯝꯗ ꯊꯤꯟꯕꯗꯧꯅ ꯇꯧꯔꯀꯥꯟꯗ ꯏꯟꯁꯨꯂꯤꯟ ꯄ꯭ꯔꯗ꯭ꯌꯨꯁ ꯇꯧꯕ ꯑꯗꯒꯤ ꯆꯥꯎꯈ꯭ꯔꯕ ꯃꯤꯜ ꯑꯃ ꯆꯥꯔꯦ in between there is long gap ꯇꯥꯗꯤ ꯇꯥꯏꯀꯣ
Oh, sir, atum matamsu khara tension banina sir na khara samlapna haibiradi.
ꯑꯗꯨꯅ ꯑꯣꯀꯦ ꯌꯥꯔꯦ ꯑꯗꯨꯅ ꯕꯔꯗꯟꯅꯤ ꯆꯨꯝꯗꯤ ꯆꯨꯝꯕ ꯑꯗꯣ ꯑꯟꯗꯔꯁꯇꯦꯟ ꯇꯧꯍꯟꯁꯦ ꯍꯥꯏꯔꯒꯅ ꯑꯗꯣꯝ ꯅꯥꯀꯟꯗ ꯂꯥꯛꯇꯣꯔꯤꯕ ꯍꯥꯏꯗꯤ
Oh, sir.
frequent meals is meal ꯆꯥꯎ ꯍꯥꯏꯕꯁꯦ is a best ꯀꯩꯅꯣꯅꯦꯕꯀꯣ ꯅꯪ ꯉꯁꯥꯏ environmental factor ꯌꯥꯎꯕ꯭ꯔꯥ ꯍꯥꯏꯅ ꯍꯥꯏꯕꯗꯣ environmental factor ꯍꯥꯏꯕꯁꯦ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯆꯥꯎꯕ impact ꯑꯃꯅꯦꯕ ꯑꯗꯨꯅ environmental factor ꯍꯥꯏꯇꯥꯔꯗꯤ we are changing our lifestyle ꯑꯩꯈꯣꯏ ꯂꯥꯏꯐꯁ꯭ꯇꯥꯏꯜꯁꯦ ꯄꯨꯔꯥ ꯍꯣꯡꯗꯣꯛꯈ꯭ꯔꯦꯕꯀꯣ ꯍꯣꯡꯗꯣꯛꯈ꯭ꯔꯕꯅꯤꯅ ꯀꯃꯥꯏꯅ ꯇꯧꯒꯦ ꯍꯥꯏꯕꯕꯨ ꯍꯣꯡꯗꯣꯛꯈ꯭ꯔꯦ ꯁꯨꯝ ꯎꯕꯤꯔꯤꯗꯅꯀꯣ ꯀꯜꯇꯤꯚꯦꯇꯔꯁ ꯀꯩꯅꯣ ꯂꯧ ꯎꯔꯤꯕ ꯃꯤꯁꯤꯡꯁꯦ ꯁꯄꯣꯔꯠ ꯈꯣꯏꯗ꯭ꯔꯦꯗꯅꯀோ ꯍꯧꯖꯤꯛꯇꯤ ꯃꯦꯆꯤꯟꯅ ꯈꯣꯏꯗꯣꯛꯈ꯭ꯔꯦꯗꯅ ꯂꯧ ꯌꯩꯕꯁꯨ ꯀꯩꯅꯣ ꯃꯦꯆꯤꯟꯅ ꯌꯩꯊꯣꯛꯈ꯭ꯔꯦ ꯋꯤ ꯗꯣꯟꯠ ꯗꯨ ꯑꯦꯅꯤ ꯐꯤꯖꯤꯀꯦꯜ ꯑꯦꯛꯇꯤꯚꯤꯇꯤ ꯑꯩꯈꯣꯏ ꯀꯜꯇꯤꯚꯦꯇꯔꯗꯁꯨ ꯆꯤꯡꯗꯁꯨ ꯀꯩꯅꯣꯗ ꯍꯧꯖꯤꯛꯇꯤ ꯈꯣꯡ ꯆꯤꯡ ꯀꯥꯗ꯭ꯔꯦꯕꯀꯣ ꯗꯦꯠ ꯏꯁ ꯑꯦ ꯂꯥꯏꯐ ꯁ꯭ꯇꯥꯏꯜ
Lifestyle
ꯆꯤꯡ
anamba
ꯀꯥꯗ꯭ꯔꯦ
adunu sir.
ꯂꯥꯏꯐ ꯁ꯭ꯇꯥꯏꯜ
Aduna
ꯌꯥꯝ ꯀꯩꯅꯣ ꯇꯧꯔꯦ
avoid
ꯑꯗꯨꯅ
tꯧdaba yadaba scenario oibanina lainadi
ꯑꯥ
thoka leirani aduna prevention makti hairaroi adudi complication se kamaina avoid tau yage haina mathangda sada na khara light set tawbiba yagani ya screening te ka tawba yabra khara laina se hana thokpa yade kari test ta leite sada
laina se akoi miyoi miron ba nupi khudimakta GCT hairiba 75 gram glucose test se tawthoga akoi laina se leite haiba khangba ngamgani laina se mi history leiragasu haibadi mama mapa natraga nahamukti pregnancy da diabetes oirasu oidrasu mipum khudimakta screening tawgadabani ꯑꯗꯨ ꯃꯁꯤ ꯇꯧꯊꯣꯛ ꯑꯩꯈꯣꯏ ꯈꯪꯕ ꯉꯝꯒꯅꯤ ꯑꯃꯗꯤ ꯄꯣꯛꯄ ꯂꯣꯏꯔꯕ ꯃꯇꯨꯡꯗ ꯃꯤꯔꯣꯟꯕꯤ ꯑꯃꯅ ꯃꯥꯒꯤ ꯍꯞꯇꯥ ꯇꯔꯨꯛ ꯍꯥꯏꯕꯗꯤ ꯃꯅꯤꯡ ꯀꯨꯝꯕꯒꯤ ꯇꯪꯈꯥꯏ ꯆꯜꯂꯛꯄ ꯁ꯭ꯋꯥꯏꯗ OGTT ꯇꯧꯔꯕ ꯃꯇꯨꯡꯗ ꯃꯥꯁꯦ ꯗꯥꯏꯕꯦꯇꯤꯁ ꯂꯩꯔꯤꯕ꯭ꯔꯥ ꯂꯩꯇ꯭ꯔꯤꯕ꯭ꯔꯥ ꯍꯥꯏꯕꯁꯦ ꯈꯪꯕ ꯉꯝꯒꯅꯤ
adudi samlapna nupise loina screening tawgadabani oigani oiroi haiba leptabida loina screening tawgadabani haina akhoi leptareba nata Masai government of India ke program da su moi recommend tawrae nako adudi sir achoba gise ngasai aina kharati kakhati ke sir na ngakti gani sanjay matam yamna watlapa de tension da paduda ai khara kakhare adubu sir diabetes tawre haidadi treatment gitamasi sir manakta loina thare ada loina patient se hekte refer tawraga abnormality na a report ta haibuda sir na loina treatment tawbra natraga observation khaidopasu leibra treatment tawradi kamaina treatment tawnabu sir khara sir adum tangda sir
ꯌꯥꯝ ꯆꯨꯝꯃꯦ ꯑꯩꯉꯣꯟꯗ ꯔꯤꯐꯔꯦꯜꯗꯤ ꯌꯥꯝ ꯂꯥꯛꯑꯦ ꯀꯩꯅꯣꯒꯤ OBGꯗꯒꯤꯀꯣ ꯌꯥꯝꯁꯨ ꯍꯔꯥꯎꯋꯦ ꯑꯗꯨꯒ ꯑꯩꯅ ꯊꯦꯡꯅꯖꯕꯗ ꯑꯩꯈꯣꯏꯅ ꯃꯥꯏꯜ ꯗꯥꯏꯕꯦꯇꯤꯁ ꯍꯥꯏꯕꯁꯤꯗꯤ ꯂꯩꯇꯦ ꯑꯩꯈꯣꯏꯅ ꯍꯥꯏꯔꯤꯁꯤ ꯗꯥꯏꯕꯦꯇꯤꯁ ꯈꯨꯗꯤꯡꯃꯛꯁꯦ ꯁꯦꯔꯤꯌꯁ ꯗꯤꯖꯤꯖꯅꯤ ꯍꯥꯏꯅ ꯂꯧꯏ ꯁ꯭ꯄꯦꯁꯤꯌꯦꯜꯂꯤ ꯏꯟ ꯄ꯭ꯔꯦꯒꯅꯦꯟ ꯋꯤꯃꯦꯟꯗꯗꯤ ꯗꯥꯏꯕꯦꯇꯤꯁ ꯍꯥꯏꯕꯁꯦ ꯂꯣꯏꯅꯃꯛꯁꯦ ꯃꯔꯨ ꯑꯣꯏꯈ꯭ꯔꯦ ꯀꯟꯁꯤꯀ꯭ꯋꯦꯟꯁ ꯌꯥꯝꯕꯅꯤꯅꯀꯣ ꯀꯟꯁꯤꯀ꯭ꯋꯦꯟꯁ ꯌꯥꯝꯕꯅꯤꯅ ꯑꯗꯣ ꯇ꯭ꯔꯤꯠꯃꯦꯟꯗꯤ ꯇꯧꯒꯗꯕꯅꯤ ꯑꯗꯨꯕꯨ ꯑꯩꯈꯣꯏ ꯗꯦꯔ ꯏꯁ ꯑꯦ ꯔꯨꯝ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯩꯅꯣꯒꯤ ꯈꯔ ꯂꯩꯔꯤ ꯁꯥꯟꯇꯒꯤ ꯔꯨꯝ ꯈꯔ ꯂꯩꯕ ꯍꯥꯏꯗꯤ ꯃꯦꯗꯤꯀꯦꯜ ꯅ꯭ꯌꯨꯇ꯭ꯔꯤꯁꯟ ꯊꯦꯔꯥꯄꯤ ꯇꯧꯕꯒꯤ ꯔꯨꯝ ꯈꯔꯗꯤ ꯑꯗꯨꯝ ꯄꯤ ꯑꯩꯈꯣꯏꯅ ꯑꯗꯨꯕꯨ ꯌꯥꯝ ꯁꯥꯡꯅꯗꯤ ꯑꯩꯈꯣꯏꯗꯤ ꯄꯤꯔꯣꯏ ꯑꯗꯨꯕꯨ ꯑꯩꯈꯣꯏꯅ ꯈꯜꯂꯦ ꯀꯩꯅꯣꯗ ꯍꯣꯏ ꯗꯤꯞꯁꯤꯅꯁꯨ ꯄꯤ WHO ꯅꯁꯨ ꯄꯤ ꯗꯥꯏꯒꯅꯣꯁꯇꯤꯛ ꯀ꯭ꯔꯥꯏꯇꯦꯔꯤꯌꯥꯁꯤ ꯈꯤꯇꯪ ꯇꯣꯡꯉꯥꯜꯂꯦ 1 step 2 step ꯍꯥꯏꯗꯅ ꯉꯁꯥꯏ ꯀꯩꯅꯣꯅꯁꯨ ꯍꯥꯏꯈꯤꯕ ꯃꯌꯥꯝꯗꯣ ꯂꯣꯏꯅꯃꯛ ꯐꯣꯂꯣ ꯇꯧꯕꯗ ꯈꯔꯗꯤ ꯋꯥꯒꯅꯤ ꯑꯗꯨꯕꯨ HbA1c ꯍꯥꯏꯕꯁꯤꯁꯨ ꯗꯔꯀꯥꯔ ꯑꯣꯏ HbA1c ꯁꯤꯅ ꯅꯤꯌꯔ
sir Hello. Sir, disconnected or cover male, sir, na online amuka lakpa, tangka ngayon sida, Ratna da kitang kaino hamzage ki asmaina buki ama se glucose challenge se so abnormal la e haidati magi antenatal checkup ta hongba lakta ma se to ina ultrasound kai ka tawba khotba darkar oibra si matang da kitang like share to bi sada ta
Yeah,
audible oibra
iche maratna audible oidre.
Okay, haha. Sigi akoina hanade dum khange koi mironbi kanosi complicated with diabetes is a high risk pregnancy haina dum khange aduga aduduna koigi regular antenatal checkup haina lairese sigi si amuka hena haidi kanogi si khara toina dum checkup se darkar ai je tabra
tai sema
Okay. I see. May laktabagi kara disconnect tawrubagi kano tawre.
ho hai ti
Adugiduna sigi kanosi antenatal checkup toiba adagidi ultrasound si kara adum magi akoina ngasai congenital anomaly haiba aduidusu khangdoknaba ultrasound si tawba adagi again progress fetal monitoring sigi amuk ultrasound si kara toina adum lawba darkar legani. Samlapna adum antenatal checkup toiba adagi kanogi ultrasound se adum normal atopa kano amadagi hena toina adum tawba darkar legani.
ꯑꯗꯨꯗꯤ ꯃꯁꯥ ꯃꯁꯥꯒꯤ ꯐꯣꯂꯣ ꯇꯧꯔꯤꯕ ꯐꯤꯖꯤꯁꯤꯌꯟꯗꯨꯒ ꯈꯔ ꯐꯖꯅ ꯇꯥꯟꯅ ꯈꯣꯠꯅꯕ ꯍꯥꯏꯅ ꯇꯥꯟꯅꯕ ꯗꯔꯀꯥꯔ ꯑꯣꯏ.
Yeah, proper regular antenatal checkup is mandatory for such cases.
ꯑꯗ ꯁꯔꯁꯦ ꯈꯔ ꯑꯣꯟꯂꯥꯏꯟ ꯂꯩꯕ ꯌꯥꯗ꯭ꯔꯦ ꯑꯗꯨꯅ ꯏꯆꯦꯃꯅꯁꯨ ꯈꯨꯝꯕꯤꯕ ꯌꯥꯅꯤ ꯁꯥꯗꯥꯅꯁꯨ ꯈꯨꯝꯕꯤꯕ ꯌꯥꯅꯤ ꯌꯨꯝꯗ ꯁꯤ ꯒ꯭ꯂꯨꯀꯣꯃꯤꯇꯔ ꯇꯦꯁ ꯇꯧꯕꯁꯦ ꯀꯌꯥꯃꯨꯛ ꯔꯤꯂꯥꯏꯕꯜ ꯑꯣꯏꯒꯦ ꯍꯥꯏꯕ ꯅꯨꯄꯤꯃꯛꯇꯗꯤ ꯇꯣꯏꯅ ꯆꯦꯛꯑꯞ ꯇꯧꯑꯣ ꯍꯥꯏꯕꯗꯤ ꯉꯝꯃꯣꯏꯗꯅꯀꯣ ꯑꯗꯨꯗꯤ ꯀꯌꯥꯝ ꯃꯣꯏ ꯃꯌꯨꯝꯗ ꯆꯦꯛ ꯇꯧꯕꯗꯣ ꯀꯌꯥꯃꯨꯛ ꯔꯤꯂꯥꯏꯕꯜ ꯑꯣꯏꯒꯦ ꯈꯔ ꯏꯟꯁꯥꯏꯠ ꯁꯦꯌꯔ ꯇꯧꯕꯤꯌꯨ.
ꯌꯨꯝꯗ ꯒ꯭ꯂꯨꯀꯣꯁ ꯇꯦꯁ ꯇꯧꯕꯁꯦ ꯑꯩꯈꯣꯏꯅ ꯒ꯭ꯂꯨꯀꯣꯃꯤꯇꯔꯅ ꯇꯧꯗꯣꯏꯅꯤ ꯄꯦꯁꯦꯟꯅ ꯇꯧꯔꯒꯗꯤ ꯃꯗꯨꯒꯤ ꯔꯤꯗꯤꯡꯁꯇꯣ ꯑꯩꯈꯣꯏꯒꯤ ꯅꯣꯔꯃꯦꯜ ꯑꯩꯈꯣꯏ ꯚꯤꯅꯁ ꯂꯦꯚꯦꯜꯗꯒꯤ ꯈꯤꯇꯪ ꯋꯥꯡꯅꯗꯤ 10 ꯅꯠꯇ꯭ꯔꯒ 35 ꯈꯤꯇꯪ ꯍꯦꯟꯅ ꯋꯥꯡꯅꯗꯤ ꯂꯥꯛꯀꯜꯂꯤ ꯑꯗꯨꯃꯨꯛ ꯍꯥꯏꯗꯨꯅꯁꯨ ꯑꯩꯈꯣꯏ ꯄꯦꯁꯦꯟꯁꯦ ꯌꯨꯝꯗ ꯇꯧ ꯍꯥꯏꯕꯗ ꯇꯧꯗꯕꯅ ꯀꯣꯛꯊꯣꯡ ꯑꯃꯅꯤ ꯑꯗꯨ ꯗꯥꯏꯕꯦꯇꯤꯁ ꯂꯩꯔꯒꯗꯤ ꯌꯨꯝꯗ ꯑꯩꯈꯣꯏꯅ ꯍꯥꯏꯖꯔꯤꯕꯁꯦ ꯆꯥꯗ꯭ꯔꯤꯉꯩꯗ ꯀꯔꯤꯝ ꯆꯥꯗ꯭ꯔꯤꯉꯩꯗ ꯑꯌꯨꯛꯇ ꯑꯃꯨꯛ ꯇꯧꯕ ꯑꯗꯨꯒ ꯌꯥꯔꯒꯗꯤ ꯆꯥꯗ꯭ꯔꯤꯉꯩꯗ ꯑꯌꯨꯛꯀꯤ ꯆꯥꯛ ꯆꯥꯗ꯭ꯔꯤꯉꯩꯗ ꯑꯃꯗꯤ ꯆꯥꯕ ꯂꯣꯏꯔꯀꯥꯟꯗ ꯑꯁꯨꯃꯥꯏꯅ ꯇꯧꯗꯅ ꯅꯨꯡꯊꯤꯟꯒꯤꯁꯨ ꯑꯣꯔꯒ ꯅꯨꯡꯗꯥꯡꯒꯤꯁꯨ ꯅꯣꯡꯃꯗ 6 ꯅꯠꯇ꯭ꯔꯒ 9 9 ꯃꯅꯨꯡ ꯄ꯭ꯔꯤꯛ ꯇꯧꯔꯒ ꯆꯦꯛ ꯇꯧꯕꯤꯌꯨ ꯍꯥꯏꯗꯅ ꯑꯩꯈꯣꯏꯅ ꯍꯥꯏꯖꯩ ꯃꯗꯨꯒꯤ ꯃꯇꯨꯡ ꯏꯟꯅ ꯋꯥꯡꯕ ꯆꯥꯡ ꯅꯦꯝꯕꯒꯤ ꯃꯇꯨꯡ ꯏꯟꯅ ꯗꯥꯛꯇꯔꯅ ꯏꯟꯁꯨꯂꯤꯟ ꯊꯥꯔꯛꯇꯧꯕ ꯃꯔꯝꯅ ꯈꯔ ꯐꯖꯅ ꯆꯦꯛ ꯇꯧꯔꯒꯗꯤ ꯗꯥꯛꯇꯔꯗꯨꯅ ꯃꯁꯤꯁꯦ ꯅꯨꯡꯊꯤꯟꯗꯅ ꯍꯦꯟꯅ ꯋꯥꯡꯉꯤ ꯆꯥꯛ ꯆꯥꯗ꯭ꯔꯤꯉꯩꯗ ꯁꯨꯃꯥꯏꯅ ꯂꯩ ꯍꯥꯏꯕꯗꯨ ꯈꯪꯒꯗꯧꯕꯅꯤꯅ ꯃꯁꯤ ꯆꯦꯛ ꯇꯧꯕꯁꯤ ꯗꯔꯀꯥꯔ ꯂꯩ ꯆꯦꯛ ꯇꯧꯁꯤ ꯍꯥꯏꯗꯅ ꯍꯥꯏꯖꯅꯤꯡꯉꯤ.
ꯃꯁꯤ ꯈꯔ ꯅꯩꯅ ꯇꯥꯟꯅꯕꯗꯤ ꯌꯥꯝꯅ ꯗꯔꯀꯥꯔ ꯑꯣꯏ ꯍꯥꯏꯔꯁꯨ ꯃꯇꯝꯅ ꯋꯥꯠꯄꯅꯤꯅ ꯃꯇꯨꯡꯗꯁꯨ ꯑꯃꯨꯛꯀ ꯍꯦꯟꯅ ꯗꯤꯁꯀꯁꯟ ꯇꯧꯕꯒꯤ ꯇꯥꯟꯖꯥ ꯐꯪꯒꯅꯤ ꯈꯟꯖꯩ. ꯑꯗꯣ ꯍꯧꯖꯤꯛ ꯐꯥꯎꯗ ꯗꯤꯁꯀꯁ ꯇꯧꯔꯤꯕ ꯄꯣꯏꯟꯠꯁ ꯃꯌꯥꯝꯁꯦ ꯂꯣꯏꯅ ꯃꯔꯨ ꯑꯣꯏ ꯑꯗꯨꯒ ꯑꯩꯅ ꯈꯟꯕꯗ ꯆꯨꯝꯅꯒꯤ ꯂꯩꯔꯤꯕ ꯏꯃꯥ ꯏꯕꯦꯟ ꯏꯆꯤꯟ ꯏꯅꯥꯎ ꯃꯌꯥꯝꯒꯤꯁꯨ ꯀꯥꯟꯅꯒꯅꯤ ꯈꯜꯂꯤ ꯁꯦꯌꯔ ꯇꯧꯕꯤꯔꯤꯕ ꯅꯣꯂꯦꯖ ꯃꯌꯥꯝꯁꯦ. ꯑꯗꯨꯒ ꯍꯥꯏꯗꯨꯅ
Dr. Helen, ꯑꯩꯁꯨ point ꯑꯃ ꯅꯪ add ꯇꯧꯍꯧꯕ ꯌꯥꯕ꯭ꯔꯥ?
ꯑꯧ ꯁꯔ ꯌꯥꯏꯌꯦ ꯁꯔ ꯍꯧꯖꯤꯛ ꯁꯔ ꯃꯣꯏꯒꯤ ꯂꯣꯏꯅ ꯀꯩꯅꯣ ꯍꯪꯖꯒꯦ ꯇꯧꯕ ꯁꯔ ꯍꯥꯏꯕꯤꯌꯣ ꯌꯥꯝ ꯅꯨꯡꯉꯥꯏꯖꯔꯅꯤ ꯁꯔ.
So like ꯃꯌꯥꯝ ꯑꯩꯈꯣꯏꯒꯤ ꯉꯁꯤꯒꯤ PregaTalkꯁꯦ ꯌꯥꯝ ꯐꯖꯅ ꯃꯊꯪ ꯑꯩꯈꯣꯏ ꯅꯩꯅꯈ꯭ꯔꯦ. ꯑꯗꯨꯅ ꯍꯧꯖꯤꯛꯀꯤ ꯑꯩꯈꯣꯏꯅ pregnant motherꯁꯤꯡꯗ ꯉꯁꯥꯏ ꯑꯩꯅ ꯑꯍꯧꯕꯒꯤ ꯔꯤꯃꯥꯔꯛꯇꯁꯨ ꯍꯥꯏꯖꯈꯤꯕꯗꯨꯅꯤ. ꯃꯅꯤꯄꯨꯔꯗ ꯉꯁꯥꯏ ꯁ꯭ꯄꯤꯀꯔꯗꯁꯨ ꯍꯥꯏꯕꯤꯈ꯭ꯔꯦ ꯃꯅꯤꯄꯨꯔꯗ pregnancy ꯃꯃꯥꯡꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯁꯥꯒꯤ health status ꯈꯪꯗꯕ diabetic status ꯈꯪꯗꯕ mothers ꯑꯗꯨ ꯌꯥꯎꯔꯤ. ꯑꯗꯨꯅ ꯑꯩꯈꯣꯏ ꯌꯥꯝꯅ screeningꯁꯦ ꯌꯥꯝ ꯗꯔꯀꯥꯔ ꯑꯣꯏ. ꯂꯨꯍꯣꯡꯗ꯭ꯔꯤꯉꯩꯗ ꯃꯍꯥꯛꯀꯤ blood sugar levelꯁꯤ ꯈꯪꯗꯅ ꯂꯨꯍꯣꯡꯈ꯭ꯔꯒꯗꯤ unplanned pregnancy ꯅ ꯉꯁꯥꯏ ꯁ꯭ꯄꯤꯀꯔꯁꯤꯅ ꯄꯟꯕꯤꯈꯤꯕꯗꯣ unplanned pregnancy ꯁꯦ ꯊꯣꯛꯇꯕꯁꯨ ꯅꯠꯇꯦ. ꯑꯗꯨꯅ sai Dr. Chobunu su high grade neurodevelopmental defects may amalay na akoi puna mangsu khange Becker's hypothesis environment external environment internal environment ki theory may amasu future diabetic or risk su khoi nei na kre mother father animak goragadi angang sing 50% lay have su khoi khange the environmental factors su nei na kre sai epigenetics ki matang su aduna khoina masinatana khoina hojiki traditional way of living dagi honga iba diet ki change dagi koi walking style it is social attitude sa panbi gre miro missing je thaina di akhoi ahan sing ima hoi matam di angang poktori habu matam su phau su hai che kapi hai hojikti complication me am tholakani haina pakhatana leibdagi most of the pregnant mothers are actually obese way and pre-pregnant obese way hibuduna pregnant obada amuk hena way halle aduna akhoi social norms se akoina khangminagadaba se akoi genes doesn't change in few years but the environment has changed very drastically and the gene and the environment interactions in a problem lies so when you talk about epigenetics like say DNA methylation higera histone modification higera RNA processing higera all these are the new findings in the last 2 decades ko aduna akoina manipuri society yamakanda akoi endocrine disruptors mayam su thole Thina mamangda plastic ta cha thaknaramde plastic achabada bottle cha thae se thoiba chemicals mayam sina adum issue effect of hormone da adugumba diets ki organic pesticides ki insecticides ki akoina akoigi hybrid grains sing carbohydrate content of the hybrid grains sing lama effect tawi and akoi in one way or other indigenous way of living the akoi promote to the car way Manipur society da like in the way we walk loina na lang sagi akoigi minon dringai da yum pan dringai da digi hauna koi healthy leina mo khana ba dakar wai chahi mai manung da amutang su koi sugar check tausi mino lagadi or yum pa lagadi hek yum pa laga check tabu su promote tausi loina na sai GDM ki screening da akoi khange hadi one step test ne am line tawre 25 gram of glucose tha ganda tawrani aduga negative wedagadi koi repeat tawni haibani 24 to 28 weeks ta sai panbi gi bu glucometer gi matang glucometer si yam ohong mo ju phange hojik ahambada di glucometer si tange na lairam dabani adu wazan also di glucometer di lupa sate sane pan da phange aduga say koi treatment gi matang di yaruk chu male hojik te talk se adana once on insulin weta ga di patient should have a glucometer at home aduga thaina di glucometer gi reading si fasting pp hena chana mani now the concept is koi sai chu panbi kre yam koi different normal manung da pre breakfast post breakfast pre lunch post lunch pre dinner post dinner bedtime amarom da hojik di diabetic guideline da high city koi high was it time in range hai khanare normal manung da pung kya range da lege 80% da lebra 70% da lebra high buduni koi target se aduna adugumba mayam laibani na we I think that this Dr. Helen mathematical agadi I think this episode should be lengthened by another part 2 because
Yes,
treatment
sir,
part yaw
definitely.
dilbana khale
I think Sunil sir is smiling. He plans to make it another session.
Okay, so should I try the listen together? Ultrasound gi matang so like for the ultrasound also the ultrasoundologist who is doing this ultrasound for the pregnant mother should be quite specific in knowing the fetal head circumference, the macrosomia, the abdominal circumference, because we should not miss those findings. Like the gynecologist also need to know some specific points besides the general ultrasound, and those histories should be taken care of.
So, Dr. Premchand, this is more of a public awareness mission. It's public education. So, we have to have very straightforward messages which you give, which is very, very pertinent to everyone knowing about it. Dr. Helen, we have Dr. Ratna also. She would like to have some questions for her. Helen, have you assigned some questions to her?
Sir, it has been questions have been addressed to all three of all Dr. Ratna, Dr. Sharda, and Santa also. Santa has given a very good insight regarding what diet people should focus on.
I have heard about.
And Dr. Ratna has explained well about the complications, the havoc that diabetes can create on mother and baby.
So can we have the message? If there's nothing to from your end, then can you ask anyone to give their one-liner message, including the
Yes,
chief
sir.
guest? One-liner message
Yes.
in maybe 30 seconds.
So
Then I'll
our
wind
chief
up here.
guest, our chief guest just shared his message. Sir, being an NCT propagator, he was telling us about how this program is being set up for the state. Sir, achobadagi, amtang one-liner message sa treatment katang the nutrition diabetes also pakatanu lambi lay treatment sini kara line amada highly sir.
Aina one liner the nga ke ai nga tang mangure because my phone was off.
Okay, sir.
Please
No
down
problem.
we talk about.
Oh,
Now DDM is very important. Karigino G talk matungda mother will become diabetes, may become diabetes, more so become diabetes. So or kaniana in dogere. Polakadulba angang singdugi future is going to be diabetic. Oirakani adunadi ngasai haibigriba so haigre first initial checkup ta so the maki test over the pre-diabetes or pre-conception diabetes or su oidrabasu first booking to that's what is check to you is a must and one pre give you many informations. There are masagi one step test, two step test on a different forum in the deep sea. I believe current or Siko. So I think GDM habisi yamamaru diabetes study ba care kurimak GDM the PBC karibino hababu future habisi bright when never ko. I don't know message again. Okay.
Thank you so much, sir. Thank you so much, sir. Ite may ratna then one liner amtang kara share to be ready take a message hoina.
Yeah, my take home message will be ngan khangdo horbana akhoi ngan khangdo horagadi section tharangdo loinamak lahoragadi complication mayam lairiba mayam se sidagi khara makhai de ngakthokpa ngamgani na this is my take home message. Early diagnosis and early precautions and preventive measures will go a long way in making the society a better one.
Okay, thank you, Jema. Dr. Sharda, any last word?
I one-liner message haizaragadi Manipur Samas Kansi, diabetes ngaktoksi, screening toktoksi, sak phajana phajana changnaina chasi, kayuba diabetes lairagasu hidak lairi, exercise lairi, honaba bukaladi ko nomadi joy ogani haibaki wakhanlonda diabetes screening toktoksi.
Most important lifestyle ngatan hantan hai rabani na santa na ekdam one liner fresh slogan type kara hai gi
adune chabase akoina khanggadabase khwai maroina atangba pot khuding mangna isa phaba natte process tawba pot ko packet lakpa akoina khalleba atangba pot then nuts chaba kanai. Okay, but sumaina tangba pot yam sophisticated ba the exotic ba sigumba pot khuding mangna isa phan gadabu natte, so we have to choose wisely. Aduna agi one liner di eat right for a healthy life si haininge aduna aina tumna phadana ngasai nutritious oiba seasonal oiba ko asigumba se charagadi ai laina dagi ngaktopa ngami, and then aigi lifestyle change toba exercise toba si additional ngasai aina haijabdo diet, medication and exercise si ahum je punna chatlagadi ngasai akoina diabetes tagi control toba ngami, diabetes se helhandaba ko nemazu phati wangbazu phati aduna control tawhanba ngami haizaningen.
The trinity to avoiding complications of diabetes and having a healthy lifestyle. Thank you, Dr. Zanta. So with this,
thank you.
Thank you so much for all the time and efforts you have put in. Sir Sunil, I would really like to thank you again for reaching out like this. I hope, like Sir Premchandra suggested, we'll have second part to discuss the treatment, more on the treatment. Thank you so much, sir.
Thank you. Thank you so much.
Thank you all.
Thank you all.
Good night.
Bye.
Thank you. And looking forward to the part 2. Thank you.
Yes, certainly we'll do that. Thank you very much. Good
Thank
night,
you.
everyone.
Thank you
And
very much.
really congratulate the whole team
Okay.
for a wonderful conduction. This is just the beginning, and we'll have such more programs in future. Thank you.
Thank
Bye.
Okay.
Nandikishore,
Okay, good night.
we can become offline.